Welcome. And so today, we can introduce Professor Ashril Yusof. He is the distinguished professor in the University of Malaya, and we have so many publications. Her index in Scopus is 8 and more than 100 papers. So please welcome Dr. Ashril Yusof.
Thank you very much. First of all, thank you, Professor Dean, Professor Tandiu Rahayu, and especially to Dr. Titin for arranging this talk. We had some problems earlier. I was very busy with my schedule, but I think today is not so bad. So inshallah, we can discuss few issues regarding sports injury prevention. Okay, you all can see the slides, yes?
Yes, very clear.
Okay, I'm going to turn off the video because it will distract my eyesight. Okay, before I start, so Bismillahirrahmanirrahim and Assalamualaikum warahmatullahi ta'ala wabarakatuh to everyone.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, today's topic, we will be looking at sports injury prevention, and this today's talk we have two sections. First section is I'm going to give a background on sports injury and how the mechanism or the etiology of the injury, and the second part is how you can conduct research, or how you must conduct research in areas of sports injury prevention. So the second part of the lecture is very heavy. So this is why we start with a slightly lighter topic first, and then we will move to the second part, which is the research. Which is, if you are a postgraduate student, or even you are the postdoc or you are a lecturer, you will benefit in the second part of the lecture more than the first part. Anyway, we will start now with the sports injury prevention topic. So my background is from medical. I graduated from St. Andrews University in Scotland, and my PhD and master's is in health and sports, and I graduated from University of Essex in England. Okay, sports injury requires special focus on identification of injuries, care, prevention, and treatment, therapies for injury management. So all these topics, right? I would say these are topics because each of these elements here, injuries, care, prevention, treatment, therapy, they are all areas, big areas in sport medicine. They are, if you look at individual element, for example, you look at just injury, you will find people has classified many different types of injury, muscle injury, bone injury. So even in each of these, it is a huge area. There is no way we can, in one lecture, you can understand all this at one go. There is no way, because it is too big. So when Bu Tintin asked me to talk about injury prevention, I was thinking that it is going to be very difficult, because in our university, sport injury prevention is one semester. So it's 15 weeks of lecture for them to understand these topics. So I'm trying my best to put all information together so that everyone can understand this topic in this context: injury, care, prevention, treatment, and therapy. So this goes together. So as we know, you have many different kinds of sports, you know. And I think in Indonesia, maybe I think soccer is still most favorite sports in Indonesia, and we always have some competition between Malaysia and Indonesia every time they do some tournament, you know. And something like war can happen anytime. I think so. And I think there's also other sports. They are non-contact. They are more aggressive, high intensity. They are not covered here, but you know, those are more racket kind of sports, like you know, badminton, which Indonesia is extremely good at. And there are other sports, you know, that requires a lot of attention. So over the decade, we found that there are more injuries happening in sports. We are always surprised why the number of injuries in sports is always increasing. The number has never been stable. So what is happening is now the technology is also increasing, but all the sports are changing their rules. For example, in the last 10 years, badminton changed their rules drastically. So the game now is shorter. The game has got shorter rally time, and then the scoring system is very aggressive. So people are moving very fast when they are playing the games. So rules changed, and that has caused training, uh, training and competition increase in rate of injury. You will be surprised that 80% or even to the 90% of all injuries in sports happen during training. The number for sports injury during competition is very less. More sports injuries happen during training. The reason why is because you spend more time doing training than competition. Most of time for athletes, soccer players or badminton players, they spend more time during training. So training is the most important aspect of all this injury care prevention treatment. So when you talk about injury, you must focus mainly on training. So we need to see the training program of an athlete in order for you to prevent injury. First thing you must do is look at the program itself. So when you look at soccer, for example, most favorite sports in Indonesia. So soccer, a player must be conditioned. So the player must be conditioned. So they do some kind of strength training to improve their strength. And there are other aspects of physical fitness, for example, the cardiovascular fitness, um, you have the strength, you have the agility, flexibility, all those components you must have to play soccer. You must always remember you play sports not to get fit. You must be fit to play sports. You know, people always think that, oh, I want to play football, then I will become fitter. My fitness will go up. That is not the case. If you want to play soccer, you must be fit first before you can play. If not, you will have injury. So, okay, that is a component of training that requires basic physical fitness. And you also require skill fitness. So you need to do some skill. If you are, for example, a goalkeeper or a flanker or midfielder, you have to have a specific skill and talent for that position that you are playing. So now you need to understand each of these components. And on top of that, before you play a game, you must have a proper warm-up. So in a training, it comprises from warm-up, normal training, physical fitness training, as well as your skill training. So all these three things must make sure they are focusing on injury prevention. Okay, I'm moving on to sports injuries. So the kind of injuries that commonly occur during exercise or sport. So these are injuries. Some sports injuries results from accident. Okay, now I want to talk about accident and injury. They are two different things altogether. right? When we say accident, we don't talk about injuries. Although you may have a cut or you may have a, so you don't classify it as sports injury. Injuries, right? In sports, you can avoid injuries. All injuries in sport can be avoided. Accident cannot be avoided. You cannot avoid accident because accident just happen. You know, something you're very unlucky. You know, the ladder fall on your head, or you are on your motorbike. Somebody hit you. Those are accident. Accident cannot be controlled, whereas injury can be controlled and can be prevented. So accident, you can never classify accident as sports injury, okay? Because sports injury, you can avoid sports injury. Accident, you cannot avoid. You cannot avoid any accident. Even when you are playing sports, you can get accident, but we never classify it as sports injury. We will always say that it is an accidental, it's a concussion, it's a contusion, something like that. We will always relate it to some kind of accident that you had. So something acute. All right. So some sports injuries can result from these little accidents. Others due to poor training practices. So if you don't have, if you're not fit enough, like for example, you don't have that physical fitness, proper physical fitness, endurance, strength, agility, for all the sports that you are playing, you must really understand the demand of the sports. For example, if you talk about badminton, what are the demand for a badminton player? So you must have a profile. You must have a profile of a badminton, a good badminton player. You're very lucky that you in Indonesia you have many talented badminton players. What you should do now is to profile these players. You profile them. You do many tests on the players so that you have all the values. For example, you know all how high they can jump, how high all the badminton players can jump. So you must have a different category of players, the junior players, the senior players, or male players, or female players. So you have to have a profile. So once you have a profile, everybody can train towards this value. But what if you don't have this value? Of course, you can look at other countries. You can look at China or Malaysia or any other country that is good in the sports and look at the values that they have. For example, some people like to watch a football game. They know Cristiano Ronaldo, for example. Then you know what is his position in football, and you can easily assess his profile. I mean, some of the profile are available online. You can see how strong is his leg, his left leg, his right leg, how high he can jump. So all these records are available. If you want to play soccer at high level, you must meet his profile, right? And then you must train to have this profile. Otherwise, if you are poor training practice and you are trying to fight, say for example, you have your Indonesian team, for example, soccer team, you are trying to play a game with Manchester United, for example. I don't know whether some people are fan of United. I'm just choosing this team. I know some people don't like Manchester United. They like Liverpool more than or Chelsea or something. Anyway, if you are playing with a team that has high profile, you cannot beat them because you are not conditioned at same level as these players. I watched many times where our Malaysian team trying to play with, for example, the Iranian football team. Our body size is too small, and then they are so big. They run very fast, you know, and there's the ball control is better on their side, for example. So these are very clear. If you see that one game is one-sided, one team is having more the balls longer than the other team, then you know that their fitness level is not the same. If the fitness level is the same, you know, in the context of physical fitness as well as in the context of skill, then you know that okay, these two teams will have a good fight. Otherwise, you think that, oh, okay, this other team will win because they are better conditioned. So always poor training practices will cause injury. Okay. And the other one is the improper equipment. So you need all the right equipment, and this one is a bit problematic because some countries, for example, Australia or German, they always have new equipment. They always have new technology into their sports, and they always have new equipment. And when they have new equipment, they always can perform a little bit better because they have this psychological insight in them, thinking, okay, now I have a better equipment than the other team, and then I should be able to do so. That always give them the cutting edge. So improper equipment. So sports that doesn't require much equipment, like football, they require high physical fitness, but some other sports require technology. Even when you talk about tennis or even badminton, there's always new improvement in the racket technology. So the badminton rackets, for example, are getting very lighter and lighter and lighter, and they have some technology as well in the aerodynamic to make the smash even faster. So improper equipment can also cause injury. This one also covers shoes. So improper equipment, if you wear the wrong shoe, everybody else is wearing a very good shoe, sports shoes, and you are not wearing sports shoe, for example, then you can get injured in your lower limb, for example. And then the other one is you don't have insufficient warm up or stretching. So I'm going to touch a bit about this warm up and stretching, maybe also in the second part of my talk. But warm up and stretching are very important role it plays in preparing you for sports. So why warm up is important? Why people spend 30 minutes before their game and then they start to do warm up? So it is very important to have the body ready for action. So you need to have, number one, warm up. All the muscle contraction can increase the heat. It increases the heat of your muscle, and we know that when the temperature is higher, the enzyme system in your muscle, the energy system in the muscle is activated. You are prepping. We use the term prep. Prep means preparing your muscle for action. So when you do warm up, you are actually heating your muscle up, and then you can get high energy production. Apart from that, stretching also, about this. I'm not sure whether you have done this lecture on stress shortening cycle. We call it SSC. SSC in stretching, for example, when you stretch, you change the elasticity of the tendon, and then it's more stretchable, it's more pliable. The term used for tendon, we use pliable. That means like when you're doing baking, some people, I don't know, Bu Tintin, you do any baking at home with making bread or something, you always stretch the dough. When you are making the bread, you put water and everything, then you pull the dough, then you are stretching it. So when you are stretching it, you are making it very pliable. Pliable means it can stretch and contract easily. So this is why it is important. So this is important that I can hear some noise.
Oh, okay. Okay, continue. I think someone disturbing.
Okay. Okay, so you get the stretching, and then stretching, you make your tendon pliable. That means you can now do stretch and shortening without problem. So this is why warm up always have a component of stretching. I mean, all warm up must have components of stretching. Whether you're talking about dynamic stretching or you're talking about what we call this static stretching, that is a different issue here. So stretching itself is very important. If you are an athlete, you have years of experience, you may find that you have developed your own stretching techniques. If you are new in the sports, you want to do more dynamic stretching. If you are already very good at it, maybe you want to think more of static stretching. I have published this paper, and if you go to, I will show you later, if you go to my Expert, you can download some of these papers on stretching. Stretching is very important because it is proven that it can improve some physical fitness. And we have proven that stretching can improve agility. That means your ability to turn left or right or going backwards for soccer players. And we have published this in some journal of strength conditioning many years ago. You can look up that paper. I think it's a very interesting paper because that specifically look at how stretching can improve performance. Okay, moving on. So this is now the hardcore of how you want to look at sports injury, how we can classify sports injury. I did mention to you that we have accident, and accident cannot be avoided, whereas all sports injury can be avoided if you take into consideration what we will be discussing now. Yeah. So in a nutshell, you have sports injuries. You know that there are many types of sports injury. You can get from you fell from your performance. You say that you dropped, you fell from your performance. You can get bruises. You can get red coloring. You can get bleeding. You can get cuts. You can get even to the drastic extent, you can get bone fracture. Right? You can get bone fracture. And those are classified into these two very classic categories. This category has been done, maybe 100 years ago. So all these things that I'm talking to you, all this whole slide here is maybe 120 years ago. People have done this, people have known this information 120 years ago. This is nothing new. So I'm just telling you to put this in perspective so that we are trying to remember all the earlier scientists that have done this work in classifying the injury. So first of all, you get traumatic injury, which is acute in nature. That means it appears suddenly. Suddenly you have muscle pain, or you get muscle pull, you get sprain, strain. So those are traumatic injuries. So traumatic injuries can happen in the quickest of time, and it always associated with all the conditions that we mentioned, especially if your fitness level is not at that standard, or you are using the wrong equipment, or you don't have proper warm-up. You can get traumatic injury quite easily. And the other one is the overuse injury. And this one always happen with the senior players because they've been playing the sports for so long. A lot of their muscle has been doing the same activity for so many years, and they have many repetitions. Every movements have got repetitions, and then they can have more of this overuse type of injury, which means that the repetitive movement can cause injury to the muscle, tendon, or joints. All right. So, and both are difficult to handle depending on the severity. And in my opinion, traumatic injury are a bit easier to handle because you can get the athlete to rest for 6 months, and then we do reconditioning therapy, and then they can come back and play. But overuse injury, if they have problem, which always mean that they have to stop playing. We always tell them, oh, you cannot play at Malaysia national level, or you cannot play in Indonesia. You cannot be in the team NAS anymore. You cannot be in the team. You can still play maybe in the clubs or something, but because overuse injury, the effect is prolonged. You know, you get wear and tear. You need a longer time to recover, and then you may have other complication that is associated with overuse injury. So now, under traumatic injury, these are the two things that I've been that I keep mentioning to you that you can avoid. You can avoid overuse injury. Sometimes you cannot avoid, really. You can avoid to a certain extent, but if you've been playing for many years, for sure you will have some issues with overuse injury. But under traumatic injury, these two things, there's intrinsic factor. This is due to the external violence, that means external forces, and this is an intrinsic factor. This is no obvious causes present. Okay, let's focus on the extrinsic factor. And these are the main problem that you have with injury. This extrinsic factor, these are the external factor that is affecting you. That means when we say extrinsic here, we always associated something that is not inert. Inert means that's not within your body. Like, for example, training. The more training you do, for example, training is an external force that is influencing your internal. For example, so training is actually an extrinsic factor. The more training you do, you can avoid injury. So always training is extrinsic factor. And this one, we always consider this as something that you can control. When you can control, right, we always say those are the modifiable risk factor. Modify, you can modify them. For example, if you are playing certain sports, you need to have a certain skill or certain strength. That means you can do training to come to that level. You can do more training, you can do more practice. But of course, that is limited to your genetic background. If you cannot run fast, for example, then you can't do it, you know. This is why we have problem competing 100-meter race in the world, for example. We have, you're trying to compete with African countries, or you're competing with Black Americans, for example. Their muscle is fast twitch muscle. They have 60 to 70% of their muscle can be trained for the fast twitch muscle, for example. Then they train very hard, they can be a sprinter. They can be the best sprinter in the whole world. For example, you look at Usain Bolt, you look at many other Michael Johnson in the past, you look at those people, they have huge amount of fast twitch muscle. They can train to be a sprinter. But Asian countries, you can still be a sprinter, but you will be sprinter in your country. You have the best record in your country, but your record is not world record. You can't compete at Olympics because your score is quite poor, for example. So certain sports, right? Certain sports, you don't have the advantage in your genetic, your DNA doesn't allow you to be good. If you look at swimming, for example, swimming is the opposite. Where you see all the Olympic records, they all are non-black. I don't know whether you realize this, but if you are a black person, you cannot be a best swimmer because you have a lot of fast twitch muscle. Your fast twitch muscle is very heavy. So if you become a swimmer, you will in the water, you will cause dragging. So when you swim, your density will drag you. So you don't have advantage to a person from Asia or from European countries. You have less denser muscle, then you can become a better swimmer. So you need to understand how far your extrinsic factor can be applied in order to become a sports person. You must also look at your genetic factor. So I'm not sure. I think with Malaysian and Indonesian, we share possibly the same kind of physical attributes, that is determined by the DNA. So it is very difficult for us to compete in certain sports at Olympic level to be good at it. But there are sports that we can compete. We are good at it, like like badminton, for example. So this kind of sports we can, because it's very skillful. You can train to play fast games. You can train to move very fast, So this game focus more on other factors, like for example, agility. You can train agility. So agility, Asian players can train in agility very, very well. So your extrinsic factor here will be more towards your agility skill, for example. This is why you really need to see which sports you can compete at Olympic level and which sport you cannot compete. So some sports, yes, you can, but most sports not easy for you to compete because, or even Malaysian players the same. There's no way we can compete for 100-meter race. Okay, so that extrinsic factor is the training thing. Okay, this intrinsic factor is no obvious cause present that leads to this traumatic. So this can also be your capacity that you cannot adapt to training, for example. There's no obvious reason you train very, very hard, but you still cannot do it, for example. So those are intrinsic. That means it's within you that you cannot come to the level. So it is not the equipment. It is not. So you have all the other factors. All your extrinsic factor is taken care of, but still you cannot perform well, and then you are prone to injury. That means it is more of the intrinsic factor. So it's your adaptation. Your body adaptation is not suitable for the certain sport. So this, all these, right? We always talk about talent ID, talent identification. So I'm sure usually the undergraduates, I think Bu Tintin, maybe you should know. How is the study in Indonesia? You may have a topic called talent identification. Yes?
Yes.
Yeah, so I think you have a topic called talent identification where you actually try to see the young athletes and then you try to see, oh, which one is good, and you try to groom them for them to become better and for the future. And then you do talent identification, and you must take into consideration both the extrinsic and intrinsic. So okay, under this extrinsic, you have the acute nature. You have an acute nature of injury, that you contract this injury. Say that, for example, you have a muscle strain, you move too fast, and then you are not doing enough warm up. You move too fast, and suddenly you have muscle strain, and this one can cause an acute problem to your musculoskeletal system. So this one can be taken care of. We always give them some non-steroidal anti-inflammatory, and then we ask them to rest. We say, okay, you come back in 3 weeks, we will test you again, then maybe you'll be okay. But chronic in nature, right? This one is if you have an injury and then you keep getting the same injury again. For example, we last week we had cases where we had climbers. They climb mountains. We have a group of people came to see us, and the problem is in climbing you always have to wear tight shoes. Your shoe must be very tight, and because otherwise you can't get grip of the rocks that you are climbing. So over the years, right? Over the years, they have this problem that the shoe is too tight, and this shoe is irritating their bones, and this has called some calluses. We call this calluses, formation of abnormal bone structure that is causing them severe pain. So this kind of pain, right? This kind of pain, because they always use a tight shoe. So all their injuries are chronic in nature. So chronic in nature take longer time to recover, and very often, right? Very often, they have to go for a special kind of rehabilitation as well to see what is the problem with their uh, musculoskeletal structures, and often, right, and often it requires longer time for recovery. So these are the classic model of sports injury. So this one you can get in any textbook. They will tell you the same story. All right, so now we talk about acute types of injury. So acute injuries, they're characterized by sudden appearance of symptoms usually associated with single traumatic incident. So single traumatic incident cause an acute injury. Pain and loss of functions are immediate. So immediately you will feel pain and then you find that you cannot function. So you need to rest. You need to be taken care. We need to do some kind of treatment on you. You know, we need to apply something to make sure that you can reduce the pain. Okay. We will go on a bit about this pain thing a bit later. So we can classify this as direct, caused by external force or collision between two players or between players and equipment. So you can get some person get hit by a hockey stick by the opponent, or your own hockey stick can hit you as well. So you can get bruises, fractures, and cuts. So these are normal direct acute injuries. So indirect acute injury caused by internal force as overstretching a ligament during sudden change of direction. So when you overstretch, always in badminton, we find players in badminton always suffer from indirect acute injuries because they always jump very far and overstretch to catch the shuttlecock. Right, to catch the shuttlecock, they always overstretch, and football as well. They always run and overstretch their leg. When you overstretch and you're not conditioned, you can get strain, sprain, and muscle tear. So this is common. These are always, we always see the bruises, fracture, and cuts for direct contact, and then you get something that internal, more indirect, we get strain, sprain, and tear. Both can be very painful, and sometimes you have a permanent fracture, which is very dangerous. Okay, sprain, strain, and bruises. So a bit more detail on this. A sprain is an injury that involves the ligament and soft tissue around a joint, such as an ankle or wrist. It is a stretch or tear of a ligament. So you get all your joints have ligaments, and these ligaments, they are attached to the bone structure. Sometimes they are attached to the proximal joint and the distal joint, the bones, or they are just covered within the proximity. You can get like common ligament tear among footballers. You can get ACL, which is the anterior cruciate ligament tear, or you can get the posterior cruciate ligament tear at a certain time. But ACL is quite common in many sports because this ACL is joining between the femur and the tibia. So it goes, it crosses. So it involves the two proximity, the proximal bone and the distal bone. Proximal means the higher bone and the distal means the lower bones. And when you have this problem, then you find that the whole joint is in pain because you have a tear in the ligament. So ligament can easily be torn. Sometimes you can get a total construction. You have a huge tear. You can pull the bones together with when you have a tear, you pull the bone together, and then you have to have a total construction, and you have to be, the doctor have to put screws and put metal paddings on your knee, and then you will have major surgery, and you need to rest for at least 6 to 8 months, and this is very long for an athlete. So always you must take care of your ligament, and ligament as well as tendon, you need to stretch them properly. Before game and after game, you need to do stretching very well to prep the ligament. Okay, a strain occurs away from the joint, so it involves twisted. So this strain is further away. Sprain is about near the joint, but strain is away from the joint, involve a twisted, torn, or overstretched muscle or tendon. So it is not at the joint itself, but a little bit further from the joint, and it can, again, it is caused by overstretched muscle or tendon, commonly in the calf, thigh, or lower back. So these are common, you know, you can get in the calf. I don't know whether you heard of shin spleen. Shin spleen, you know, always happen on the front part of the tibia bone, where you get tear of the muscle, and it is very, very painful. It is a very annoying pain. That once you have this problem during training or competition, you have to stop totally, because the pain is unbearable. It's very painful. Okay, some symptoms and signs. You get pain at the site of injury, loss of power in the injured area, swelling of the injured area. So swelling, the whole area can be swollen. I have seen cases where you get swelling of the knee. The size of the swelling is like a football size, you know. The swelling is huge. So swelling, always associate with symptoms of sprain and strain, because you get fluid from the plasma going into the area, so that it tries to protect the area. It's trying to bring all the antibodies. It's trying to bring all the immune system to protect the area from infection, for example, or protecting the area from inflammation. But in this process, you have swelling. But swelling, right, can be huge in the proximity. That means in the appendices, like the knee, for example, or any other joint. But swelling in the head area is always small. You can hit somebody and you will see that the swelling in the head area is not big, because the thickness of the skin in the head area will not allow huge swelling to happen. Okay? And then you can get nausea. You feel like, you know, you're going to vomit, you know, and you're feeling faint. That means you want to pass out. You see stars moving, you know, around your head, and then you feel that you feel like you're going to faint. Okay, you're going to pass out. You get pale, cold, and clammy skin due to shock, and then you can also have huge amount of sweating, because you have this anaphylactic reaction that can happen to you, this traumatic shock that can also cause sweating. So all these are together, you can get symptom of sprain, strain, and bruises. Okay, now we like to move on to chronic injuries. Before I end this lecture, the first part of the lecture, we can do a Q&A on the first part, so that you have fresher question. If you have any, you can ask me. Okay, so chronic injuries, gradual onset, commonly caused by repetitive light trauma or soft tissue or bone. So the keyword here is repetitive. That means it is the movement or the injured area is being repeatedly used. So you are, even if you have small pain, you keep on playing, and after a while, right, after some time, you can get where the pain is unbearable, or you have some problem that leads to a trauma, or it becomes from acute, because you've been doing repetition, then it moves to the chronic injuries. And I told you chronic injuries are very painful, and we have a picture here showing this guy here having problem with the shoulder. He's a pitcher in softball, and you see that they always suffer from the elbow muscle of the elbow, areas of the elbow and the elbow joint having sprain and strain, because they repeatedly pitching. They're always pitching, and the speed of pitching is very, very high. Okay, and this leads to weakness of the injured area, and then you get insufficient rehabilitation after injury. So if you are injured and the doctor say you need 6 months, you should take the 6 months and rest, and then do conditioning. You don't come back and play, because sometimes when you play too fast, the term here is RTP. RTP is return to play. The doctor always note there RTP 6 months. So that means you have to rest for 6 months. And after that, if the doctor say, okay, you are cleared, you can now play, then you're okay to play. But otherwise, if you don't have sufficient rest, then you can get chronic injuries. A lot of players suffer from this because the club wants them to play, and then they are injured because they are being paid very high by the club, so they have to play. So at the end of the day, who suffers? I think the player will suffer because they keep playing even they are supposed to rest, because the club push them to play, because the club has spent a lot of money on them. So this always happens to professional players. They are in trouble, you know, and they have always chronic injuries. Okay, then you also have these overuse injuries related to chronic injury due to excessive and repeated use of same muscle, joint, or bone, and you can get gradual increase of pain. So this pain can build up. I mentioned about shin splint. You can Google this, and you can watch video on YouTube about shin splint. You find that a lot of athletes, if your sport involve a lot of leg movements, you can get shin splint easily. This is why you need to condition yourself well to avoid getting shin splint. So shin splint is in the tibia area. You can get muscle tear of the anterior muscles of the tibia. You can get tears that happen, that pull, because the muscle is attached to the bone itself, and the bone is and the skin is very close to each other, and this is why you can get shin splint, and it causes painful, and you can change the color of the area as well. It can be purple, can change to purple, and we know that something has happened to the muscle. Okay, this is in the nutshell what happened when you do repetition. You can get this tissue injury, and then you continue your activity, and the pain becomes unbearable. And when the pain becomes unbearable, you need to go and rest for your healing process to happen. If not, right, this process will go on, and then you get inflammation. And when you repeat this cycle without having this rest, you're not going into this path, you're not having this rest, then this cycle will always lead you to overuse injury. So this is another classic. I think this module was presented in 1946 or something. So it's very old model about overuse injury, but I think the theory is still correct. So this is a very old module. Okay, common sites of sports injury. So these are some photographs I took. You can get ankle sprain, for example, ankle sprain. You can get groin pull. You can get hamstring strain, and of course you can get shin splint. All right, and this one is common. This is most common. You can get hamstring strain. Why you get hamstring strain? Okay, this is interesting, because whenever I go to meet coaches in the football association, they always ignore. They don't really put strength and conditioning training in their schedule, in their timetable. Even if they put strength training, they don't focus on hamstring. They always look at everybody is doing to have a nice quadricep, so that they have a nice shape of quadricep, but they always ignore hamstring muscle. So when you ignore hamstring muscle, you can get a lot of problems. So I mean, I would say that if I were to investigate all the injuries that I have attended to over 20 years, the last 20 years, I would say that 80% of the case is, I can tell you that they have problem with hamstring training. They're not doing enough training to their hamstring. Yeah. Their hamstring is not conditioned to the sports they are playing. They always focus on quadricep. We know the agonist and antagonist muscle, but people always try to do more work with the quadricep. So they always do knee flexion, knee extension, you know. They always ignore doing the hamstring curl. So they always miss that. Maybe it's a bit boring to do, but I don't know, everybody just like to do knee flexion, knee extension. And then they have nice quadricep. But then now what is happening is you have ratio. You need to understand this ratio. So I'm going to tell you about this ratio. This ratio is what we call the agonist antagonist ratio, where you have a prime mover. For example, you have the prime mover of the leg, which is the quadricep. So you need to measure the strength of the quadricep. So here you can measure the strength of the quadricep based on these two things. So you can measure the concentric strength using an isokinetic machine. I am not sure whether you have an isokinetic machine.
We don't
huh?
yet. Not yet have. Not
okay,
yet.
I think you must have a isokinetic machine in a university. You must have. Otherwise, you cannot. The student won't learn how the force is being developed in the muscle during contraction. Then there is also difference between concentric contraction and eccentric contraction. So you can do a contraction of, say, you do eccentric contraction of quadricep or it doesn't matter, but you have to do the same for your hamstring. So then you take the strength of your quadricep and your hamstring and you do a ratio. So if the ratio, right, you find that quadricep is always stronger because quadricep is bigger. Quadricep is always a bigger muscle. So quadricep is always stronger, you know. So then you see that, okay, now you do a hamstring strength, you do a concentric hamstring, then you see that now the muscle of hamstring, it must be at a ratio that is acceptable. For example, you think that for a good footballer, you can allow maybe 20 to 25% difference between the agonist and antagonist muscle. Then you must make sure that the player are at this ratio. Sometimes the quadricep is so strong, you get 60% of quadricep and you get 40% of hamstring. So the ratio is imbalanced. They're no longer 20 to 25 or 25 to 30, depending on what you set, the range you set yourself. Nobody can, I mean, you need the profile. You need to profile Ronaldo, for example, for footballer. Then you see what is his strength. Then you say that, oh, everybody should be like this, at least, you know, at least. I'm not saying exactly, but you should be at least. But when the ratio is bigger, then automatically you know that the person will have problem with injury. For sure, 100% sure. Whenever you have imbalance that is more than 40% in any sports, you can get injury. And we see this happening even in badminton players, because badminton players, they always play in their right hand, and as they're always doing smashing. They are only interested in smashing. Not many players focus on the backhand, for example. Yes, they do, but more on smashes. In any badminton games, you have more smashes than backhand stroke. That's normal. This is normal. You can watch any of your top badminton players, you watch their player, and you see that in 20 minutes, you see that, oh, maybe in 20 minutes, you see that maybe there's around 50 smashes, and you see maybe around 10 backhand strokes, you know. So you see there's always imbalance between these, you know. So when this happens, you can analyze the game. You can analyze the game on the video, one thing, but the more importantly to me is to look at the agonist and antagonist strength, because all the problems that you have with hamstring strain is because your quadricep is too strong. When your quadricep is too strong, it's pulling the hamstring. So it's your quadricep is super strong. Every day you do training with quadricep. So when you are kicking the ball, you can easily, if the movement is very fast, like you are running, you're changing speed, then you kick, for example, then you find that you can pull your hamstring. Then most of the sports that happen. So I talk about agonist and antagonist, and I talk about this ratio. But there's another thing that we need to know with all the strain and sprain is you always have the dominant and non-dominant. So this is a one whole lecture series that can take 1 hour easily about how dominancy. So we use this term dominancy. Dominancy means your brain is set. You are a right footer, or you are left footer, or you are a right hander, or you are left hander. So this is set in you. This is intrinsic. All right, this is intrinsic. So I can't really control whether when a child, right? You can't really control. Okay, this child, I'm going to train him to be a right footer or right hander. You can't really do that because it's programmed. So this term, right, is called dominancy, and dominancy is a problem and advantage at the same time in sports. So, okay, first of all, when you have dominant, you must know that every time you do any reaction, you will move the arm or your leg, that leg first. So if you are when somebody throw a Coca-Cola can at you, you catch it with your right hand. That is a test for you are a right-hander, because if you're left-hander, right, your immediate reaction will be your left hand. If you are right, your immediate reaction will always be your right. So now you also have imbalance. I'm just okay. If I were to talk about hamstring, since hamstring is the main problem in most of the sports that I face, you have hamstring of the right leg and you have hamstring of the left leg. Now, I talk about the agonist, antagonist. Those are unilateral. Unilateral means they are on the same side of the leg, unilateral. But when we talk about contralateral, we say that between left and right. So now you also have problem in strength between left leg and right leg, because you have a dominancy effect. When you have dominance, you definitely have difference in the ratio. So you have now left ratio and right ratio. So now how much you should allow the difference to be. So in the football, they always say 10 to 15% of difference are allowable. So people are training both legs. They train left leg, right leg, so that the difference is only around 10 to 15%. If you have more if you have discrepancies, you have what we call deficit, when left leg is stronger than right leg, or right leg is stronger than left leg, then you find that this thing also will cause problems. So now this is you have intrinsic value, which is the dominant effect. So I'm trying to bring back the thing that you have learned earlier, the intrinsic factor. So dominancy is an intrinsic factor. So now with improper training, extrinsic factor, you don't do enough training, then you get injured because your left leg is not balanced with your right leg. So now you also must do a contralateral. Okay, so now you learn you have agonist, antagonist, and now you also learn you have contralateral between left leg and right leg. Okay, the other thing that is scientists found in the last few years, in the last 5 or 6 years, they found that speed of contraction is also important. The left foot contraction and the right foot contraction, the speed must also balance. So you not just do the strength, you must also go for power. So now you must do training at high speed. So not just to improve the strength, but to improve in the speed of contraction, because speed is also a extrinsic risk factor. So 3 things that you learned today about something that is not normally covered, but very, very important aspect of injury when we talk about the strength of muscle in the context of sprain and strain. You always must consider these 3 things: the agonist and antagonist effect, the ratio between antagonist and antagonist, the contralateral effect between left leg and right leg, or left shoulder and right shoulder. So this muscle must be equal, right? If you are measuring rotator cuff muscle of the left, then you must measure the rotator cuff muscle of the right. So you must balance this, okay? And the other one is the speed of contraction. So this is why you need the isokinetic machine, because the isokinetic machine will allow you to measure the contraction at different speed. And with this speed value, right? With this speed value, now you can do a different calculation, because now I can do speed at, you know that in any angle, you can have a movement in the planar, in one plane, you can move it at various degree. You know, for example, you can move your arms 60 degrees, 70 degree. The degree is not an issue, but the speed to get to the degree is the issue. So you can measure something within 10 degree, how fast you can push something for 10 degree, as in angle, or you can do at 60. So obviously 10 is a faster speed, 60 is a slower speed. And if you have 90, then it will be even a slower speed. For you to have all this speed at different, all this movement at different speed, also allow you to have different calculation. Well, what we call the dynamic control ratio. So now the new term that people use to explain this is the dynamic control ratio. So it's DCR. So dynamic control ratio. So you learn many things today about all these changes in all related to strength and speed, power. Then you can see, you can understand now how you put the intrinsic factor into practice, and then how you now put the same issue and see what are the modifier risk factors. So now you have to do training with both legs. You have to do training agonist, antagonist. Now you have to train at speed as well. So there are many things to consider if you are going to be a coach. And I think I have a huge audience, maybe 70, 60 people today. And if you are thinking about coaching, and if you don't have this knowledge, you will not be a good coach. To be a good coach, you must have this knowledge, because otherwise your players will have injury. And then it is unfair for you, because you are not allowing them to progress in the right way. And then you throw them out from the team because you have a new player. You want to take a new player and you say that, okay, this player is injured. This player is injured because you didn't provide them with proper training. You have no knowledge about proper training, and you are making your athletes suffer because you don't provide them enough information how in the right way you need to do your training. Okay, so it's very important. This is why injury is a very important topic. It's something that takes around 200 hours of lecture for in my university. It's 200 hours of lecture for one student. Do you have the same amount of hours spent?
Yeah, I think we need more, but in here just we got 1 semester for injury prevention.
Okay, that's good. I mean, 1 semester is good enough to learn many things. Okay, so okay, I'm going to move on. Otherwise, I will be behind time. How about time? It's already 11. I'm trying to do the second part. Okay, you have other injuries like tennis elbow. So these are some other example. It's an injury to the muscle or the outside lateral aspect of the elbow that results from overuse or repetitive. So this one can happen, you know, tennis elbow. The term used tennis elbow because in maybe 60, 70 years ago, a lot of tennis players suffer from this problem, and you get areas that is swollen. You get the radial tunnel tenderness. So this area of your muscle becomes very soft, and then you can get pain, and you cannot do any more contraction. All right. So and it affects the lateral epicondylitis. So it involves the elbow joint. So these are some examples. Okay, I'm going to move quickly on the chronic traumatic encephalopathy. So these are injuries that is related to the head. So once, if you are playing, you know, like for example, American football, rugby, ice hockey, or boxing, you can always get somebody hit you in the head. When somebody hit you in the head, you can have concussion, or you can get brain trauma. And this is also something that is common in this kind of sport. So you can get many complications You can get knockout, complete knockout. You can just fall on the ground and then you are unconscious. You know, it's that bad. It is very severe, because a severe blow to the head can cause what we call this punch drunk. That means you become I don't know what is the Indonesian term, but we always say pening, you know, pening, and you can get vomit, muntah. I don't know whether it's the right same term as in Indonesia. Pusing, is it?
Yeah, pusing, same.
Yeah, okay, yeah. All right. Okay, main symptoms, you get disorientation, dizziness, and you can get headache. And you can get memory loss, social instability, and erratic behavior. So these are a common problem where you have trauma to the brain area. And all these, right, when we see these symptoms, we know exactly it's not just the muscle area or something, it also relate to your nervous system. That means we will put you on stretchers immediately, and we will carry you out from the field, and then you will be, you know, we will not allow you until we make assessment to your nervous system, because otherwise the damage can be permanent. Especially if it involves bleeding in the head area, that is severe trauma. That means you go to trauma hospital. You go to hospital, you be in the trauma unit immediately. And then you can get progressive dementia. You can only lose memory. You don't know what you're doing. Muscle movement is very slow. You cannot talk. You can get tremor. Your hands are all jerking. You can get vertigo. Your eyes turn to white sometimes. You cannot hear anything. And sometimes you feel like you are dying. You feel like you want to commit suicide. You cannot bear it anymore. You want to just die, you know. We have that kind of symptoms as well. Okay, so I think these are the for the brain. I'm just going to talk briefly that you need to do a MRI scan, and then we do a CT scan just to measure, to see the areas, how bad is the damage in your brain if you have bleeding, for example. So we need to do certain tests. Whenever you have concussion, you have all the symptoms that I mentioned, immediately you need to be put into the MRI and CT scan. So we will scan your brain. Okay, the other one is whiplash injury. This is also common. When you move your head, you can get hyperextension and hyperflexion of the neck very fast. That happens too fast. It's like, you know, sometimes, right? This movement is in gymnast or something, that you can get acceleration of the neck, that the force transfer to the neck is fast. It's just like somebody they call whip-like movement. It's like somebody, you know, I don't know whether it's the right term in Indonesia, like when you hit somebody with rotan. You know what is rotan or not? When you hit somebody, the movement of the rotan is like whipping. You know, when you whip something, you find that it is hyperextension and hyperflexion. You can get the neck area. And this is the RTA. RTA means road traffic accident. Most of the cases in RTA in the hospitals are road traffic accident. Very few are sports. But yes, you can get some in sports. But in hospital, 53% of cases are related to, because if you are in the car, you have to brake emergency. When you brake emergency, your neck is moving forward and backward very fast. So flexion, hyperextension very fast. That can cause, you know, front, back, and side sometimes. You can get whiplash injury to the neck. You can get in contact sports injuries. You know, even in you can get these kind of injuries in gymnasts if they're not conditioned very well. Accidental or international blow to the head. Child abuse. Sometimes you can get these in when in hospital cases where a child is having problem. The parents shake them too hard, and it causes their head to move very fast, and also can cause whiplash injury. And whiplash injury can easily cause death as well. Yeah. Okay, you get cervical acceleration, deceleration injury. So it's the same concept to the cervix. So you have the neck area, and mainly the neck area is called the cervix. Okay. Okay, the risk factor here of now intrinsic. We talk about the dominancy. Here is the muscle imbalance, and I have focused in detail about muscle imbalance. You know, we have spent a lot of time talking about muscle imbalance. And the other one that is important is this postural defect. Postural defect, right, is because your bone structure did not develop in the way that it should be. For example, we find that I don't know, in Indonesia, child go to school from the age of 6 to I think until 16. Until then they go to college. So in the primary school, for example, from age 6, year 1 to year 6, for example, primary. So they are younger school student. They are not playing enough sports. Every day they are playing computer games, or they are just playing with their handphones, or their body posture is not good. So you get postural defect. This is very high. In Malaysia, is alarming. We just presented this to the Ministry of Education, but I'm not sure whether they're going to increase the PE time, physical education in school, to look at the curriculum, because the physical education in school is not helping the kids now. In these days, year 2020, the postural defect is very high in school children. If you look 5 years from now, you will find more problems in the secondary school, and in 10 years from now, you find that people working in all the working sectors, private or government or whatever, they also have postural defect, and they will have a lot of problems working. Then the country will not be productive. So postural defect, right? You can get upper limb, lower limb, many things. So this postural defect is intrinsic factor, because you are not doing enough, and then your bone is not developing, or your musculoskeletal structure is not. Of course, you can also have normal defect. That means you're born, you get congenital. We call this congenital. That means you're born with it. You have problems when your mother have you in the womb, in her tummy. When you're born, you have that problem. So those are spasticity or congenital postural defect. That means you can't really help it much, but most of the postural defect that we find these days is because the bone is not developing due to habits. Okay. And then you get overuse types of intrinsic. You get age. The older you go, I think overuse is quite similar to these two put together. And then you get age. As you go older, yes, you get problems in mineralization of your bone or something. Those are something that you cannot help, right? So those are factors, but you're trying to reduce it. You can make it slower. And you have other poor technique that you have in you. You have the poor technique in you that you cannot help. You even how hard you're trying to train, you have the poor technique that you cannot get rid of. You know, that also becomes an intrinsic factor. You cannot help it anymore. And then, of course, the inadequate warm-up always affect the intrinsic factor. So these are the factors that can together involve in the intrinsic risk factor. So how to reduce the risk or hazard? You must increase your health and fitness level. So this is very important, health and fitness. I told you from the beginning that you must be fit to play, not to play and become fit. Okay, so fit to play. So health and fitness, skill and technique. So you must train well. You must keep your hydration level normal. So you must be under EU hydration. So EU hydration, you must monitor your urine level. You must drink a lot of water. I think you must, if you're an athlete, you should drink around 3 to 4 liters of water a day. So you must make sure that you're properly hydrated, because a lot of injury, especially those related to heat types of injury related to hydration. And you need to do warm-up and proper warm-up and proper warm-down. Correct clothing and equipment. So clothing is also important, but you don't want to wear heavy clothing when you are doing activity that produces a lot of heat. You don't want to wear, full, I don't know, track bottom and whatever, and you play football, for example. You want to have proper clothing, because clothing can also affect thermal. It can affect performance for sure. And clothing plays a lot of advantage as well when we think about clothing for certain sports and new technology. I think swimming as well, they come up with certain technology that clothing can reduce drag. Correct footwear and attire. So you need to have, I think this is material of clothing. So this is attire. This is how you should wear. For example, you don't see people wear gymnasts and they wear full clothing in their gymnasts, for example. So attire is more of the style, fashion, but clothing is more of the fabric, the material. Okay, so you shouldn't wear jewelry. So Tintin, if you have a lot of gold, you cannot wear gold rings and whatever. It's dangerous. Okay, it causes hazard. And you must obey all the rules, because if you disobey the rules, this is where you start to cause problems on yourself and on others as well. So this is why in sports, they always have disqualifying, or they say, okay, we disqualify you, we give you red card, for example, because you disobey the rules, you know, because rules are there to protect people so that people don't get injured. And you yourself don't get injured, because you make a lot of people in trouble if you have injuries. So obeying the rules is important. Okay, treatment, right? So you get treatment depends on type and severity of the injury. So mild sprain and strain can be treatment using RISE. So this is why I'm coming back to the therapy, where you need to put all these things together. And this is the treatment side. When this is a common. So this one is, I think, found in maybe 60 or 70 years ago. This model called RISE, where RISE stand for rest, ice, compression, and elevation. So this is common. Every sports people, I think, when they play, and then when this RISE method, R is rest, so you need to rest, and during this resting period, it will allow your injured area to cool down. That means if you have a area that is swollen is what, bengkak, is it in Indonesia?
Yeah, right.
Bengkak. So okay, bengkak. So if you have bengkak, 2-3 days, you will have the area going down to the normal. So you get what we call this downside. So you get the size going down, and during this period, right, you must make sure that you rest. Some people, they have injury, and especially in Malaysia, they go and find this dukun. You know dukun? I don't know. Is it the same term in Indonesia? So they have this dukun, or yeah, so they go and midget, right? So they go and do this massage and everything. But during this period, you should rest. But then if they go to massage, and then these people don't know what they do during this massage, the swelling gets bigger.
Yeah.
Yeah, the swelling gets bigger, and that causes more problem, you know. So every time you have injury, you should rest. Unless you have trauma, you have bleeding and all this, and you should get immediate attention. But if you just sprain and strain, you should really rest, you know, 2-3 days. Don't go and see this homo or dukun or whatever, and then you get yourself in trouble. So you need to apply ice. So ice will reduce the pain. And then you need to compress. You can compress the area swelling by slowing the flow of fluid to the area. Some of these new technology, they have this like bandage that is included ice inside. You strap around your muscle, and you tighten, you compress the area, and it cools the area at the same time, right? So we call it the ice compressor. It's the same concept. It's an ice compressor. You can buy, I think you can buy this easily online. Yeah, it's getting cheaper and cheaper, coming from China or something. So yeah, so nowadays is combined ice compressor, and then you can get, you need to do elevate. So you reduce the swelling, encouraging more blood flow to the heart. So you elevate. If you have leg injury, you raise, you put some pillow or something. So in hospital, they sometimes tie your leg to a string, and then they pull up higher. So you get elevation of the arms or legs, right? So these are common. This is RISE, you know, and I'm sure they have make this into modern concept by including other things as well. But I think this is a basic, the RISE technique. If you remember RISE, you're okay, you are safe. Other things that we want to give people, common thing, is the non-steroidal anti-inflammatory drugs. So it's NSAID. So NSAID is common. The most common NSAID is ibuprofen. Some people give it to athletes if they have bengkak, pain and swollen and stuff. So this one can help reduce the pain. So this is quite good. We always have NSAID ready in our first aid kit. We always give the athletes to take this. Yeah, but some people also need painkiller, so you can get vasopressin, something you need. You sometimes also have some painkillers, but you must have a medical doctor in your team to give painkillers. Sometimes we also have painkillers ready in our bag. We give them painkillers, and sometimes we also have injection because they cannot bear the pain. We just use local anesthetic to make them reduce the pain, and we take them to the hospital. Otherwise, the whole time in the ambulance they will be crying, you know, and they will be shouting. So we give them, you know, normal is NSAID. I think you can go to pharmacy and buy NSAIDs. They're over the counter. Immobilization, so you put some kind of strap or something. You don't want to mobilize the joint much because you want to make sure that the area heal very fast, you know, prevent further damage and reducing movement, reduce pain, muscle swelling and muscle spasm. So this is why you need to wear this strap. You compress, but at the same time, you try to stabilize the joint so you have less movement. Okay, and then yeah, this is the one that injection we talk about, corticosteroid injection. This is only by medical practitioner, so you need to have a doctor in your team to give you this corticosteroid. Physiotherapy, this is important. This is when you already heal, you are in the healing process. You know, the doctor say that now we can use massage, you can do manipulation. And I think 2 years ago, I went to University Yogyakarta. I was in Yogyakarta and I attended the talk about Indonesian sports massage. It's unique to Indonesia. So I learned something from University Yogyakarta, how the Indonesian physiotherapists do sports massage. I think it's quite good. It's a bit different from Malaysia. Manipulation and special exercise to improve range of motion. So this is ROM. So once you have injury, your range of motion is impaired. So you cannot move your arms like what Bu Tintin is doing. You cannot move the arms well. So your range of motion is dropped. So if you are doing your therapy, we always try to make sure that you increase your range of motion until you can do all the movement correct to the angle that we want. Then we cannot say that you are RTP, you can return to play. We always say, oh, you need 1 more month, you know, you need to do more therapy, you need to have more strength conditioning. Okay, long-term injury can be treated with a program, walking, swimming, help strengthen the muscles. So some treatments are overused type of treatment that can drag, you know, 6 to 8 months of therapy. Then we also put them on swimming, you know, so that they can strengthen their muscle. They cannot just be lying down and do nothing much. If their leg is problem, we put them swimming so that the water lift their leg and reduce the what you call the gravitational pull, and that helps them to heal faster. So we do also aqua therapy. So aqua therapy is famous now because a lot of places offering aqua therapy for old people, even young people, athletes, but it's very popular among old people. They go for aqua therapy because that improve their strength. At the same time, you know, they play with their friends and something. They play water polo and stuff. So it's getting popular, very popular. If you have a piece of land, I think in Indonesia, you now make a swimming pool. You advertise aqua therapy for old people. They will come because they have nothing to do at home. They will come and enjoy exercise in the pool. Okay, the other one is heat treatment to increase blood flow, relieve pain, and increase flexibility. So this is during the therapy process. Once you have healed, then we can do heat treatment. We can do heat treatment. We can do heat treatment. I think in my place, we just purchased a new equipment. It is called high laser therapy. So we have now high laser therapy. We are now treating patient that is recovering from osteoarthritis. We are now have a special clinic in my office now. We are doing high laser therapy treatment for patient with osteoarthritis. So we have now getting patients in, but I think now it's a bit slow during COVID. It's not good, but we now try to do this because now it increases the blood flow, it relieves pain, and it increases flexibility. So we have these 3 things. And in old people with osteoarthritis, this improves the range of motion, back to ROM, range of motion, drastically. Even if they come after the 3rd treatment, they can walk very faster than before. So even after the 3rd treatment. So now we think that with this new treatment, high laser therapy, you can Google this, high laser therapy for osteoarthritis, you will find that it improves all these at the same time. Increase blood flow, relieve pain, and increase flexibility. So one treatment can improve all these, and then they can walk they can walk much faster. So high laser is good for heat treatment in 2020.
High laser therapy. Yeah, I just see that.
Yeah, you can see that we just purchased this equipment. I think it costs I don't know, around Malaysian ringgit, around 200,000 Malaysian ringgit.
Wow, expensive.
Yeah, it is expensive, but we get a lot of patients. I think in 6 months we will get our money back. Yeah, so we always invest and we get money back because patient will they pay the services. Okay, surgery. This is the last process, right? When you do surgery, you need to do bone treatment. So when we talk about this, you need to do stitches. We need to use fix with bones with wires, plates, screws, and rods. I did mention to you this. So these are the total construction that we talk about. It can happen. Usually, it involves the internal fixation, where it involves the bone. So you need to have like X-rays and stuff. We need to put you on this before we can detect where are the pain, right? And then after all these, you need to do rehabilitation. So rehabilitation, so now the last part of before you come back to play, you do rehabilitation. Start with alternative training. So normal, you cannot do the normal training anymore. So we figure out an alternative training for you. You need to engage to a sports physiotherapist, not the normal physiotherapist. So sports physiotherapist, in Malaysia, we have a specialized. I think in Indonesia, you also have the massage, the specific massage one, the one that I went to University of Jakarta. And I think it's very good because they also do alternative training. Circuit training, you need to do many types of stations so that you involve your functional. The important keyword here is your functional training. All these, right, is the functional training for you to come back to play. So circuit training, conditioning, endurance, flexibility, strength training, stretching technique, warm-up, weight training, all these, right, are in what we call functional training, so that we look at your ability before you got injured, then we try to make you come back to play. Or if we decide that you cannot come back to play, we will still do this, but then later we will think whether you can come back to play at all. If you cannot reach the range of motion fast enough, or you have other problems, then maybe you cannot compete at high level anymore. Okay, and then prevention, the mirror of all those things that we have been mentioning, the prevention of sports injury, the main topic that we are discussing, and we have put all these together at random, but later we will look at the second part of the talk. We will look at warm up, for example, because we will be focusing on these a bit. Okay, warm up, cool down, hydration, so proper technique, equipment, physical conditioning, facilities management, balance opponents. Remember, I talked earlier about if you are trying to compete with Manchester United, your fitness level must balance. Your opponent cannot be too strong. If they are too strong, then you will have injury. All right. So the opponent must have balanced opponent. So this is why you need to continuously train, even during COVID time. You need to train because otherwise your opponent will become stronger. I think Malaysian team are not very strong now. If Indonesia is playing Malaysia tomorrow, I think Indonesia maybe will win, because Malaysia is having a huge problem with training and lockdown due to COVID. All the training center is closed now, and they've been closed for 6 months. It's very long. Okay, and then rules and enforcement again, right? You must follow all the rules as I mentioned earlier. Okay, so I hope you guys can remember all the things that we have discussed today, because the next part will be the second part of the talk, which is more focused a bit on research, on how you're going to go about research. So if you are undergraduate, you may think that if you want to go on and do masters or you want to do PhD, then maybe it can help you try to organize yourself when you do research in injury prevention. Okay, maybe Bu Tintin, we can open for some questions, and I'm not sure what are the questions, and maybe we can take questions for the first part.
Okay, so anyone to have a question? Okay, you can raise your hand. If not, I can try to asking. So dehydration. So in Indonesia and Malaysia is very hot, right? Tropical, and here maybe about 30, 35, 35 degree. And when the people usually like doing sport, like my son, like a soccer, playing soccer. So how many minutes? I mean, not how many minutes. I mean, when is the best time to drink during exercise? When playing football or doing soccer or doing badminton? Because in here very hot, and we don't know which one is good for our body. Usually, they cannot drink after they finish doing exercise like that.
Yeah, it's a good question because drinking hydration always lead to injury, and we always stress that you must drink adequately. So I did mention 3 to 4 liters of water a day for athlete. That covers Malaysia or Indonesia, but during when you are exercising, the American College of Medicine always advise to drink every 15 minutes. So every 15 minutes you should drink at least, right, 400 ml of water. So 400 ml. So you're talking about maybe a glass of water.
400.
Yeah, 400 ml. So not 1 liter, but every 15 minutes you can drink, depending on the severity of the weather and your body and everything. 400 is the amount that you can drink, so that you can safely continue to play, continue to do your exercise without having problem. But some people, if they are a runner, they usually don't have much time to drink. They always drink a little bit less, but they drink more frequent.
Yes.
Yeah, but I think the American College of Sport Medicine suggests every 15 minutes. So if you're playing football, every 15 minutes, they must go to the side of the football field and drink some water, or they go behind the goal post and drink a bit of water.
Is it same also when during competition?
Yes, correct.
Okay.
Yeah, we have seen cases where people die of dehydration in football. We have seen so many cases, but on not many cases as in reported cases, but we have seen videos showing. It appears like it's many cases. The cases are not huge, but we are saying we have seen cases, and there are many videos showing this death related to heat exhaustion. Because heat exhaustion, you get heat exhaustion at the same time you are pressing your cardiovascular system to pump very hard because you need to do a lot of activity, and this cause you have to have complete heart failure because the blood is so thick, so thicker and getting thicker and thicker, and then you still have to pump very hard, and the heart just fail, and then you just pass out, die.
Okay. How about the composition of water when we drink to hydration? It is same. We need to put like a sugar and salt together because we know that we are doing exercise. There's so many chemical that burning, right? So also losing when we have a sweat. So it is just drink water, or we need to put something in there.
Yeah, we usually have what we call electrolyte drink.
Yes.
You heard of this Gatorade?
Gatorade?
Gatorade is a famous in the whole world. It's the most famous drink. It's for sports because it has glucose and it has electrolyte. And this Gatorade is I think it has been in the market for maybe 60 years or something. It's a very famous electrolyte drink. So you have electrolyte and you have sugar, and I think the sugar is not more than 6%. Yeah, so if your game is long, like marathon or runner, or you are playing football, it's good to have drink water during the game, but when you have the halftime, you can top up with electrolyte drink with sugar. They always have both together. If you notice with Manchester United or Chelsea or whatever, every time they play game, there's a huge, they have a huge water carrier behind them, and inside the water carrier, they have a name of each player. So every player will have their own bottle. And because all the position is different, so they require different electrolyte and different sugar levels. So it's personalized, and they have different names there, and they drink from the same bottle, the bottle with their name. Yeah.
Thank you very much, Professor Ashril.
Okay.
This is Miss Professor Ariati. You want asking something?
Yeah.
Okay.
Actually, I just write it down. By the way, I have a handball athlete. They are a very long time. They had an injury for the knees and the feet and the arms. Most of the feet, recently the coach find out if the athlete most problem with the feet, they had a flat feet. So we found out because the agility and they're not really stable when they exercise. So how long the therapies or the cure for helping them, because maybe it's too late to find out and for a while, and then we have to face the national games in next year.
Yeah, I think with flat foot is a postural defect. It is in the same category in the slides that I show you. Those are postural defect that is, it can be caused by congenital. That means you're born with it. That means it's if you're born with it, then it is impossible, almost impossible to overcome this. But if you develop lower arch, because you have the foot, right? Once you're flat, yes, you can do an arch training to make it a bit higher, so that you have better control of the footing, because the arch is better control.
Okay.
Once you're flat, you have sway. This is a problem where you have injury with flat footers, is because once your leg is flat, you can't sway. You have what we call medial lateral sway, like that, medial lateral sway. Yes. But you can also get anterior posterior sway. So with flat footers, you get higher on both sides, anterior, posterior, and medial lateral, compared to people with high arch. Higher arch, you are stable. You're very stable. You don't sway very much, because you are the force, the ground force, the base BOS, the ground force is spread nicely, and you have a good reaction with the ground. So you can do certain training to improve them. It depends on how old are these players. If they are 20 years and above, I don't recommend them to do any more. They shouldn't be in the team at all. If they are below 20 years old, then maybe you can consider these people to do some kind of therapy to improve them. There is a therapy where you actually lie on the ball and trying to grip the ball and try to do a lot of exercises with the ball. So you roll the ball with the bottom, with the sole of your foot, and then try to grip it. That is the training that we always do for flat footers. But we always work with children, young athletes. We never work with national. You're talking about national competition. If you're talking about national competition, if they are having this problem with flat footers, in my opinion, they shouldn't be in the team in the first place. Yeah, so you are taking players that is already prone to injury, and if you cannot correct them very fast at that time, maybe you give them 6 months to improve, then you think that okay, they cannot improve, then it's not easy for them to be in the team. Although their talent is high, they may be very talented, but then you are exposing them to injury, and you have to answer to God. You're causing them injury, because you're not, you know that, okay, they're talented, but you didn't tell them the exact truth that if you continue to play in this condition, you can get this kind of injury. You're not telling them this. If you tell them this, maybe they think, oh, maybe I don't want to play, you know. Yeah, so this is more of a decision of at management level rather than the athlete, whether now you think that if they are playing at national level and they are having flat footers, they will have higher sway. When they move, they will have higher sway. Many studies have shown that if you have flat footers, you have medial, lateral, anterior, posterior sway, and you are not stable. You can cause injury. And if you are, not providing them enough training, then maybe you should, think of maybe they should not be in the team.
Oh, I see.
This is more management decision rather than the athlete should be what they should be doing. They should be doing it long time ago. They should be identified long time ago. They have flat footers.
Cannot to be athlete.
Cannot.
Yeah, because will be more injury happen, right?
Yes.
And okay, Mrs. Ariati.
Bu Ariati,
Yes.
we can't hear you actually.
Okay.
Good, right?
I want to ask you because you mentioned about below 20. So when you say we can like maybe provide more exercise, do you think there is a recommendation about the shoes maybe? Because I know shoes can be effective for the foot.
Yes, but I think a shoe plays a role. Yes, we always talk about shoes. There's special shoes for all this kind of problem. You need to custom made these shoes. But I
Okay.
think most important thing is for the postural defect. You must correct them physically first. You must do physical intervention first, and then together with the shoe, and you see whether they can improve. Because a main factor now is they have postural abnormalities. We call this postural, what we call this misalignment. We call this is all under body misalignment.
Okay, thank you. So the other question is from Tania. Tania, you want to ask him directly? And Madip Bang. Tania, you there? Okay, so we are reading for Tania. So Tania asking about ethyl chloride spray.
What is that?
Ethyl chloride, so it's something spray. If you get injury in the match or competition, there's something give spray suddenly in the injury. So is this good or danger when we use that?
Oh, it is not dangerous to the athlete. It is dangerous to the environment because it destroys the ozone. Anyway, what this spray is doing? This spray contain what we call high absorbent local anesthetic. Yeah, it has a high. Okay, the analogy is this: if about sore throat, if you have problem swallowing, sometimes you cough and you have inflammation of the neck in the throat area. Sometimes you take these sweet. You can buy this in pharmacy, and this sweet, right? You take it. It has something. It makes the throat nicer. Have you heard of Strepsil?
Yes.
Yeah. Yeah, so you take Strepsil. So Strepsil within the Strepsil, it sometimes have lozenges. Lozenges is natural compound, can be synthetic, can be natural. So lozenges can act as what we call local anesthetic. It makes the area of your throat less irritated. So you find that it's better to take. Otherwise, you'll be coughing, or you feel pain in your throat, sore throat. You get sore throat. And so what lozenges is doing is acting as an LA, is reducing the pain. So it's the same thing with this ethyl spirit. What it's doing is acting as a local anesthetic. It reduces pain for a while. It reduces the pain. It is not dangerous, but it reduces the pain area for a while, so that if it is not severe, you don't see any anything bleeding. It's just the athlete say that, oh, I've dropped and then I have some kind of concussion and I feel a little bit of pain. But when you examine the arms or the legs or whatever, you see nothing serious. It's not anything broken or no bruises, and you think, oh, okay, I can apply this spray. So this spray provide something like a local anesthetic. It goes to the area. It makes the nerves, because it goes into the skin very fast, and it makes around the area, the nerves, the pain receptor of the nervous system to be desensitized, so you can tolerate pain a little bit better. But after that, you will get the pain again.
Oh, I see.
Yeah, so it's okay, but people don't like to use it these days because they say it destroys the ozone layer. The spray is not good. It has high carbon molecule.
So just giving ice.
Yeah, you can give ice. Yeah.
Okay, that's good. Thank you. And this is one more from Madipang Lady Utama. So he asking about open kinetic chain and closed kinetic chain. This is kind exercise can do in the sport for athletes. I mean for sport, for athletic sport.
Yeah, those are what we call closed kinetic chain and open kinetic chain. Those are applications, some technique in training. It is, you know, I cannot say it is good or bad. It depends on the sports that you're playing and how well the training suits the players, because it is not the concept of open kinetic or closed kinetic. It is more of the element that can cause injury. So it is not about the concept. So the answer is yes, you can do any kind of training, but you must make sure that it covers all the risk factor aspect. So it is not about the concept. It is more of the element inside this. You know, like I say, warm up is good, but actually, right? What is the component of the warm up is making it good, isn't it? So it's something like this, you know. So I really must. To answer properly, you need to see the detail of the whole open kinetic chain and closed kinetic chain. You know, some people use it in periodization to avoid injury and stuff. They have the micro training and the macro training. It's a lot of concept in coaching. I don't think I can address this specifically, but as far as I know, the concept is okay, but what the element inside is more of concern.
Okay. And then more question. Thank you. More question is from Andi Nurcahyon. Oh, no. Dedi Saputro. Dedi Saputro, you want asking directly? Dedi? Okay, so Assalamualaikum warahmatullahi wabarakatuh. How do we as teacher deal with students who have broken bones while playing futsal at school? So it means what he do when they got the student get fractured.
Yes, I think one thing that we didn't say much today is the first aid. You know, CPR. You know, I think you study this in university, and you know, I think that in our university we teach the student in the first semester.
Yes,
they learn
resuscitation.
Yeah, CPR. They learn about the ABC, the RISE. So when you have sudden injury, you must do the ABC, you know, and you must check everything, and you must make sure the patient destabilize, don't move much, and then you try. If you are trained in CPR, you know how to lift the patient. Yes. You know how to, you know, you have, if somebody has neck injury, you cannot just carry the person normally. You have to put the sideways and put the cloth, and then you roll the patient, and then you lift with 4 people, lift it, put it on the stretcher, and then use the neck guard, for example. So those are things that you learn in the different concept, which I didn't focus today, is a CPR, and you have to do this, and then you have to take the injured athlete to hospital immediately. You cannot wait anymore. There's no time to wait. You must have ambulance ready, and this is why in all events you have ambulance ready, isn't it? So I think immediately you must do the CPR. You must do the first aid. Then you must take the patient out of the play area into a safe zone, and then you must transport the player to hospital, because there's no way that you can treat bone fracture in the field. There's no way. If you found a way, if you do it, then you will be jailed. I think so.
In here must be have license.
Huh?
I think in other country must be have license. Like in Taiwan, if you don't have license, you cannot do anything.
Yes, correct.
Yeah.
You must have all these ready. Yes, you cannot do anything without it. Yeah, true.
Okay. So Fahri Hussein, you want asking something? Okay, you can ask directly. Fahri? Okay. Unmute. You can do unmute. Okay. Okay, Fahri. Okay, you can asking.
Belum ada nih Bu Titin.
Oh, but when you raise your hand.
Ya, masih.
You raise your hand. So, okay, so that is very good, and I think you still have more slides, right?
Yes, I have more slides. Shall I carry on quickly?
Yeah. Just go to the slide.
Okay, let me continue. So I'm going to turn off the video. Stop video. Okay. Okay, so Tintin, can you see the slides again?
Yes.
Just to make sure, okay?
I can see it clear.
Okay, so now it's very important. The second part of the talk is more towards how people should do research, research in this area of injury prevention program. Why we say this is because a lot of studies they didn't consider many factors in whenever they design an injury prevention program. They didn't consider, for example, the need of the player. They always think, oh, they need to solve this injury quickly. They need to now consider the more things about the player. For example, they also need to see how does this player relate to the function, when we talk about the functional training. So the functional training, how does, every time we talk about research, is always focus on one aspect, and then we want to see this thing to work. It doesn't mean in this context. I think at the end of the talk, maybe you can understand it a little bit better. But I must say that this part of the talk is a little bit more complex. Okay. So why injury prevention? So why people do research in injury? This is a picture of a guy who got injured in a football match. So this is a severe case where wrong footing, this could be an accident. So playing sport is always not good in a way that, because it can always associate with high risk of injury. So the best thing is not to play sports, because when you play sports, you always have high risk of injury. So the decision is up to you, the person. If you want to play sport, there's always this risk. You cannot avoid not having this risk. So you have to be very careful. So importance of injury prevention. So trying to reduce the cost of hospital, you need to stay healthy. Players' time on the field versus time off when you are injured. So you need to take care of all these problem very well. But these days, I think there's a private hospital, there's also government hospital. You can get treatment very fast, and of course at higher cost. Okay, so if you have higher cost, you can treat the injury faster and better maybe. Okay, 3 groups of these injury prevention that you must consider. Initial prevention. So this is This is to prevent the injury. So all these factors that we've been discussing today can prevent injury. So, you know, wear gear or whatever. So I just put one example here, but it can be any of the factors that we talk about today. And secondly, second prevention, recognize injury and get help early. So this is the police model: protection, optimal load, the ice, compression, and elevation. So this is an advanced version of the normal rise. So now it's called police. Okay. It has still the ice, compression, and elevation, but now you need to prevent this. You have to have a protection. You need to have optimal load, so that the muscle that is working is not overused or overstretched or over your capacity. Okay, so that you're protecting yourself. So final prevention: concentrate on rehabilitation to decrease the inability. So this one is the three things that you need to now put into consideration, right? Here we already talked about the modifiable risk factor and the non-modifiable risk factor together with the intrinsic and extrinsic. We have discussed this already. I'm going to move quickly. Risk factor for sports injury, same thing in intrinsic and extrinsic. You know this. Basic injury preventions. Injuries are not accidents. So I tell you many times today that, you know, injuries can be avoided. Accident just happen. It cannot avoid it. This one is what we call takdir, isn't it? In Indonesia as well, eh? Takdir. So this determine, you cannot control this. So injury are often understandable, predictable, and preventable. So you can understand it, you can predict it, and you can prevent it. So those are injuries. Okay, specific injuries share similar characteristics of person, place, and time. So the common factors about injuries, like you can get common injuries that you always get because you have poor habits or something. So this is your own characteristic, your own intrinsic values causing your injury. So this, you can predict this to happen. You can understand it and you can prevent it. But sometimes are related to place, for example, like certain place that you go, you are prone to more injury. For example, if you are, you know, playing in an area that you are not used to, you're prone to have more injuries because you're not used to the place that you are playing. And of course, the time, sometimes you travel, you have a different time zone, or you have, you know, you have not spent enough time. So time, it has very many aspects. Time in training not spent well enough, or time zone different, or you have, you go and then you are in Indonesia and you go and compete. Suddenly the game is in winter, you know, it's cold. You're not used to it. There's time, you know, for your adjustment. It's not enough for you to have time for adjustment. So time is in any context can cause injury. So by understanding injuries, intervention can be developed and implemented to prevent and limit extent of a given injury. Meaning that now you want to have a program. You want to do a program that to reduce injury. Say that, for example, you found that a lot of injuries happen to hamstring, for example, in your team. A lot of injuries. So now you must design a training program to have more hamstring training. You can do Nordic hamstring, for example. You can do more of this kind of training to improve hamstring muscle. So you must understand the need of the game, the functional aspect of the game, in order for you to understand, predict, and prevent injuries. So now you see that, okay, after 1 year of playing, a lot of players suffer from hamstring pull. Then you know that your training has not enough of hamstring training. So you must include more hamstring training. So now you need to design. So you need to see the need. What need? You need to do the need analysis, and then you see now we need to do hamstring training. I'm just giving an example. It can be any training, okay? Okay, William Harden in 1974 talked about the first conceptual framework of studying injury. So for an active action, and they have an active action, that means you are now introducing a new training. So you are actively doing an intervention to improve some action. You can be jumping. Here I just use landing because people always land and then they always fall and have injury. So you can have active action. So you can also have passive action. That means you doing, here is active action. You are actually doing a lot of training, jumping and landing, for example. So this is active action, but you can also do passive action. For example, now I look at the balance between left and right. I know if I improve my left and right, when we talk about the contralateral strength, we talk about the left leg and right leg has deficit. That means if the deficit is too far, bigger than 40%, you know that you have injury. So now you focus on your training is focused on your balance, but at the same time, you find that it can increase your jumping, for example. Because now one passive action improve other things, but you can also do active action to improve the particular sport itself. So this is, in sports, there's always something like this. You can do the real exercise, jumping and landing, but you can do strength exercise in the gym, for example, reduce the gap, the deficit. At the same time, you find that now the people can, your player can land better because the left and right is better. So one passive action improve another function. So this is active and passive. Okay, so you must consider this. In order for you to understand all the training, you must understand perfectly what are the things that you want to change now. What is the need that you need to change? So by studying a specific injury with a matrix in mind, one can identify the modifier risk factor and identify points of intervention in the casual sequence. So you can do, for example, the sequence, we will focus a bit more with football later, because in football it is a bit clearer. Other sports is clear, but I think football is more document. There's more document on sports of football, so that you can understand better. We will look at this sequence in a while. Yeah, so just be patient for a while. Okay, and then there's some developed new concept. They talk about the host, vector, and environment. So here, the host is a person experiencing injury. So what they do is they have a form like this. Now, if you have injury, your coach can put now what is a host, what is a vector, what is the environment. So every time you have injury of a certain player, you have the host, vector, environment record for you to discuss with the doctor or the practitioner. So this is good to practice. So everybody have these host, vector, environment forms. Every time you have injury, you record this. Who is the person experiencing the injury? What is a vector? Is it a bicycle or a car? Is it a football? Is it during a football game? The guy can't hit well. He got injury related to the head. So those are something, the vector that caused football caused head injury, for example. Those are the vector. Environment, physical or socio-economic conditioning surrounding the event. Here you can add more information about the environment. Say you are playing home or against, or you want to talk about the temperature of the day, or you want to talk about the hydration level of the player. So those are something that governed by environment. And these three phases, you can do intervention. At pre-event phase, you can talk about the event phase, and you can do research, you can do intervention at post-event phase. Pre-event phase, you can talk about warm-up, for example. Before they do the game, they do some kind of warm-up. And during the event phase, for example, you make sure they drink enough water, they have enough hydration. For example, they are wearing the right clothing. So this is the event intervention that you can talk about. Post-event intervention, you can talk about recovery phase. You can talk how fast you can make the recovery. You can talk about nutrition. You can talk about physical resting. You can talk about other modalities like the cold bath. Some people go into the cold shower or cold bath, and then they try to reduce the temperature. So all these, right, the pre-event, event phase, and post-event are all interventions that you can do to improve the performance of the athlete, and at the same time reduce injury. All right, and this is another model that talks about in 1992 by Van Mechelen model. This is a model that they talk about establishing extent of injury, problem, incident, and severity. And this will lead to establishing the etiology mechanism of the injury. So here, you need to understand why the accident, or sorry, not accident, why the injury happened. So now, somebody have a hamstring pull. Why does a person have hamstring pull? Okay, maybe it could be he doesn't drink enough water, hydration level, or it could be the conditioning. The athlete is not conditioned well. The athlete is not conditioned well. The strength of the muscle, the antagonist-agonist ratio is problem, or the problem lies in the contralateral deficit, or the problem lies in DCR, the dynamic control ratio. So this is where you start to identify why the mechanism involved in injury, because here is where if you want to do intervention, for example, you can now start to say, because you don't have enough training, you have deficit, you want to do a balanced training, left and right. You want to do a contralateral ratio training, make sure agonist and antagonist ratio are better. Or you want to look at the speed of training, where you want to look at the dynamic control ratio. So here is very important. You need to understand, before you can do a research, you need to understand what is the need. Now, you need to understand what is causing the injury. Without understanding what is causing the injury, you cannot design the program. You cannot just say, oh, okay, today we're just going to do this program and we think that this program can reduce injury. You don't understand what is causing the injury. You must understand perfectly. If you look at what we call the prevalence of injury among Indonesian national team, football, basketball, all these informations are available at your national level. So you go and find out how many people injured in badminton and what are the injuries. So if you want to design a intervention, you need to understand. First, you establish the injury is present. That means the incident is real. Then you need to understand what is causing this injury. Then you design a program hoping that your program can improve this injury. So you need to see, okay, now I'm going to do Nordic hamstring exercise. Nordic hamstring, do a lot of exercise when you are trying to forward your body with your knee on the ground, for example. That will cause huge force production in the hamstring that you can do training with Nordic hamstring. Then you know that your hamstring can become stronger. So this is why you need to understand, establish the etiology and mechanism. So understand perfectly what is causing the injury. Introducing a preventive measure, then you design the preventive measure, then you assess. So now, how do we assess? I told Bu Tintin that you should have an isokinetic machine because you can make assessment all at the same time. The three things that I mentioned to you, agonist, antagonist, the contralateral, and the DCR, can be done in half an hour. You know, in 30 minutes, you can get all the data for all the risk factor assessment. That means you have one machine that can take care of three things at the same time. That means you can assess effectively, right? You need to have effective. As far as I know, only isokinetic machine can do this assessment. If you don't have this isokinetic, you have to do manually. It will take you 4 hours or 5 hours, you know, and your patient or your players will be very tired. I don't think they can focus for 5 hours. And isokinetic can take care of this in 30 minutes. Okay, so this is a model of 2006. I've given to Bu Tintin the PDF file of this strip analysis. I want you guys to read this strip analysis before you design your exercise intervention program, is to understand this strip analysis. So in the past, we have the Van Mechelen model, the one that I mentioned earlier, the Van 1992. Look at the 4 stages. So these are the 4 stages, right? Whereas 2006, Caroline Finch produced this module, and I think now almost a lot of research in sports use this model, especially for football. So you must have the injury surveillance, number one. I just want to talk briefly. You can read the whole paper. You have the paper. You can read the whole paper. It's very new. If you are Indonesian team, you are applying this one. You are the first in Southeast Asia doing this. Even in Malaysia, I have spoken to many people. They don't want to do this. They prefer the old way. But this is good way because it gives you a good research information, and you can you can reproduce this treatment or this approach anywhere you go. So injury surveillance. So you need to see your prevalence. I told you, you go and see the record of all Indonesian players from the year 2000 to the year 2020. So you have 20-year record, and you can see how many types of injuries that has changed from 2000 to 2020. You can have a good idea what is causing the injury, what is changing in Indonesian training that is causing injury. You will find that in football, the injuries are the same. You get lower limb injury highest, for example. You get the causes are the same, but sometimes the sport shoe has changed. The technology of sport shoes has changed for 20 years, for example. You need to consider all this. So you need to have an injury surveillance. So you need to have a data of prevalence of injury among a club or a team or a national level, or you want to see it other countries as well. You can try and see whether people have published in other countries. Okay, then you establish the mechanism. So some are the same with the Michelin model, but they have improved in the way to do it, right? So develop preventive measures. So here the word introduce changed to develop, because now develop means now you need to see the level of the players at the same time. If you are talking about younger players, right, they can do higher intensity therapy easily because their muscle is growing, you know. So develop here means that you have to take into consideration many things. You take into consideration of gender, you take into consideration of age, you take consideration of the training age or the competency of the player. So you develop this so you can have a lower frequency therapy, or you have a higher frequency therapy preventive measures, you know. So it depends. So this is why they use the word develop. It reflects better than introduce, because introduce can just be at one module. Here can be various aspect of modules that you can talk about. So ideal conditions, scientific evaluation. So you can use isokinetic machine, but you can also use other model. You can use, if you are measuring agility, you can use the Illinois agility test. You can use the t-test drill. You can use many tests that suits the game. Not all agility tests can fit for football, for example. You must choose the best test. So this is why you need to see the ideal here. What is the ideal test that you can do to measure the improvement in the preventive measures that you are doing? So this is very important, because you now have to consider the reliability and validity of your test. You must choose a test that is reliable. That means you can test today and then the test can be repeated and it gives you a reliable result the second time, third time, for example. If you are not using a reliable method, then you cannot reach this ideal condition. So here in research, reliable and valid tests you must use. There's some I think there was a book by Catherine Thurston or something published years ago that talk about all the specific tests for football, all the specific tests for badminton, all the specific tests. So it measures strength, it measures other aspect of physical fitness. At the same time, it also tests your skill. It's very important in football or in any sports. You want to measure the injury at hand, the injured musculoskeletal area. At the same time, you want to also measure skill. So if they can improve in their strength, you can measure skill at the same time, then it's very good. So these ideal conditions, right, you must put together the rehabilitation or the intervention program, looking at the injured area, and secondly, must also look at the skill together. Okay, describe intervention context, right? So you must describe. So this intervention that you're doing will now say improve hamstring injury. So you are going to design a program to improve hamstring injury, then you must see that hamstring injury is prone to the three things that I mentioned to you. For example, the agonist, antagonist, the contralateral, the dynamic control ratio, for example. So those are the tests that you can do. So you have to describe the intervention in the context of improving, and then you want to evaluate them based on this ideal condition here that I mentioned to you. And then you can evaluate the effectiveness of the, here we talk about a program that you must have a control system where you want to see whether your program is effective. So now this is more of research method design, where you're actually doing what we call pre-post design with maybe two groups. One group is doing your intervention, and the other group doing another intervention, or not doing any intervention. They're doing normal rehabilitation. Then you have a control group. So here, the effectiveness can only be confirmed by statistics, not by percentage change. It's no longer descriptive. It's more of analysis. So you must think about statistics here. What statistics you can use? Pre and post value. You're talking about maybe ANOVA, two-way ANOVA, or ANCOVA, or MANCOVA. So there's many statistics. I don't want to scare you here, but those are the statistics that can evaluate effectiveness of preventive measures, right? So this trip analysis is something that we want, a new concept. So you must take these stages in trip. Once you have these stages, whenever you do a research in any sports intervention, you are safe. That means you can, if you want to publish your work, people will think that it's easier for you to publish your work because you have all the information needed from the trip analysis. Okay? Okay, these are some of the things that you can think about. Intervention, you can talk about education, like teach injury mechanism. You can talk about time takeoff. This one is related to football, yeah? Wear the right gear, which football shoe you should wear, strengthen muscle, training safe surface, increase flexibility. So all these are normal areas in football research related with intervention to reduce injury or injury prevention. So these are the common areas. There are more areas, of course, there's more areas, but this is a common one. All right. Elements for injury prevention program. Okay, this is the same thing as we talk about open kinetics or closed kinetic, but this is more important because whenever you design an intervention program, you must think of all these elements. You must have neuromuscular training. You must have balance training. You must have strength training, plyometric training, flexibility training, cutting training, core stability training, improved knowledge about injury mechanism, and aerobic training. So all these components you must consider when you design an intervention program. We will look at this specifically when we look at 11 program, 11 plus warm-up program, and this is another, the Harmony warm-up program. This is the two famous warm-up program in the world today. And you see, this is a sequence they do in the training. And I want you guys, if you have the time later, you look at all these elements, the neuromuscular, balance, plyometric, cutting, and all these elements here. Are they available in the FIFA 11 Plus program? Here they talk about running component. Here they have the elements that they talk about: straight head, hip out, hip in, circling partner, and all these are elements in the running program. And they always talk about strength and plyometric and balance. So all these will improve the neuromuscular strength and balance and all that. Sideway bench, hamstring. Again, they are also focusing on hamstring. Single leg strength, squats and jumping. If you compare to another program, this is more popular in European countries, the Harmony warm-up program. You find that they don't focus so much on hamstring. And you find that this program, if you do this program, you find that your players will not improve in hamstring strength very much. Improve a little bit. This program, FIFA 11 Plus, will improve hamstring more than the Harmony program. Here we talk about, specifically looking at the Harmony. So the take-home message thing when you do research is consider the trip analysis by Finch 2006, and then consider all the multifaceted elements that you must do. The training at least 2 times for 6 weeks. So in order for you to see improvement, you need to do at least 6 weeks of training. and all these elements must be included. So I want to end my talk today with this important thing. If you are going to do design and injury prevention and you want to think about research and publishing your work, you must consider the trip analysis, how you're going to provide all the information. And then in your training, you must also consider whether you have all these elements: neuromuscular, balance, strength training, plyometric, flexible cutting. You may have one missing, is still okay, but you must have at least, in my opinion, you must have at least 6 out of 9, you know. Okay, I think with that, I would like to thank you all, everyone, for listening to this talk. And maybe we can have a small short time for Q&A for the second part. Bu Tintin, if anybody got any question about specifically about injury prevention in context of research.
Okay, thank you very much, Professor Ashril Yusof. It's very clear and very interesting topic, and how we can make some research about injury program, especially in football, right? And we have a question before, is about cramps, but I'm sorry, this is before. So have a question from Fakhri Hussaini. So he asking about the causes of cramp during sport, and how to avoiding the cramps. This is
muscle cramps. Okay, muscle cramps usually are associated with poor conditioning of the muscle. So first thing, you need to do a lot of this training here. We talk about neuromuscular training, balance training, strength training, plyometric training, flexibility training. So these are the main cause of cramp because the muscle is not conditioned. But it can also be caused by hydration and electrolyte balance. So sometimes you have muscle cramp after you play for 60 minutes of football, you have muscle cramp. Muscle cramp doesn't happen very fast. It only happens after some time because at certain time your electrolyte level is dropped, which means that your neuromuscular system is not functioning because it cannot do contraction. Once you cannot do contraction, your muscle is in midway. You know, I don't know whether you remember physiology. You have the what we call the sliding filament.
Yes.
Right?
Sliding filament.
Yeah, so you have sliding filament. When you don't have enough electrolyte, the sliding filament just stop half midway. Yeah, it stopped midway, and then this is why you get muscle cramp. You get muscle suddenly this muscle will not relax. The muscle is contract at midway, and you have pain associated with it because, of course, you have muscle stop working, and of course you have to now rest, and then you have to drink, and then you have to wait for a while until the electrolyte now relax the muscle a bit. Yeah, in order to avoid this, you must do all this training first. And make sure before the game, you drink enough electrolyte drink. Like I mentioned to you, Gatorade. You can now Google what is Gatorade. Gatorade is famous electrolyte drink for football.
Gatorade. Yeah, and here in Indonesia, it's difficult to find Gatorade.
Oh, it's okay. You can mix yourself. You can buy the electrolyte solution, and then you can put orange juice or something. You can mix it together yourself.
Okay, and you say in here, dynamic stretching is more important.
It depends on if you are if you have a less experience in playing, dynamic is better for you.
Okay, and this must be at least 2 times for 6 weeks.
At least, yeah, 3 times is good.
Yeah, and the last that our have research is about 3 times and for 6 weeks.
Yeah,
just minimum 3 times 6 weeks.
Yeah, 3 times is good.
Okay. So does have any question again? Maybe they are still in here. Fahri, is it clear for you? Okay. And do you know in here plyometric training and about plyometric training? So what should they do for the kids? It's same also like doing hard fast step test can do that.
For children,
Yeah.
yeah, for children is less than adult because they are still developing. So with plyometric training for kids, we always reduce the intensity by half.
So reduce the intensity.
Yeah, reduce the intensity by half because we don't want them to do too many plyometric training when they are still young.
Mhm.
When they are, I think when they reach 15 or 16, then they can do normal plyometric training.
Okay. Oh, and
Yeah,
this is
15 or 16. I think for girls is maybe 12 to 13.
for
Girls are faster than boys. Yeah.
oh, okay. 12 it can be used for girl.
Yeah.
Okay. This is have a question from Dr. Yeti Makarina. Dr. Yeti, you want asking directly?
Thank you, Dr. Titin. Prof, I would like to ask about any supplement. Is there any supplement should athlete consume before sport to prevent cramp? Thank you, Prof.
Oh yes, I mean they can drink the electrolyte. I told you you can drink Gatorade. But if you don't have Gatorade, you can just you can buy electrolyte salt. You can buy electrolyte salt from shops. You can order them. Then you can mix them with water, and you can add. Say you can add if your players they like Ribena, for example. You know Ribena, Titin, yeah.
Webinar?
You know, a blackcurrant drink. They like cordial drink. Some players they like orange flavor drink. They like blackcurrant drink, or they like apple drink. You can mix them together, but make sure it's not more. The sugar is not more than 6%.
Not more than 6%.
Not more than 6%. So you do 6% solution with electrolyte salt that you can buy from pharmacy or shops, or you can buy online. Electrolyte salt you can do yourself. You don't have to buy. So those are we don't consider them as supplement. We consider them as hydration strategy. Supplement is when you have a calorie breakdown from the macronutrients like carbohydrate, protein and fat or something. Then you talk about supplement. But when we talk about hydration strategy, then you can just say, oh, we just have this drink. You can have electrolyte drink with 6% of sugar.
What about coconut water? Oh.
Yeah, you can drink coconut. Yes, I think it's more expensive to drink coconut water. I think it's more expensive.
Yeah, it's in here, but 11,000 per.
How much is it? 11,000. How much in US dollar?
In US, 0.8 US.
Oh, it's still expensive.
Okay.
Yeah, I think electrolyte drink is a lot cheaper. I think you can maybe spend around 50 cent of 0.5 of USD, or even less, much less. Sugar is cheap in Indonesia, I think.
Yeah, it's cheap in here, but 12,000 for kilograms.
Yeah, I think 12,000 1 kilo. You can 1 kilo is enough for one whole team.
Okay. In here, I think in Indonesia we have oralit, right? We call oralit is combined with salt and sugar. Sometimes that the people get.
Yes, you can take it. You can take orally if you want.
You know also oralit?
I know it's available in Asian countries. In Malaysia, in Malaysia you can find Oralit as well, but I think in Malaysia Gatorade is more popular.
Gatorade. And this is from Teresia. Teresia asking about Pocari Sweat. Is it good also for hydration?
It's the same thing. Yes, it's okay. Yeah.
I have ever heard here that if you drink milk, it can be help you to easily to how to say, to remove lactate or something.
Yeah, some people take milk after game. Yeah, it's a good strategy. Some people have shown good improvement in recovery with milk.
What kind of milk? So we can use
Fresh milk.
fresh milk.
Yeah,
No,
not soya milk, cow's milk.
cow's milk. Why not soya milk? Why?
Soya milk has less protein.
Ah, I see. So how about with the chocolate? Usually have put also chocolate in there. I ever had this is more better for recovery than just only milk.
I don't know, maybe chocolate is good, but chocolate is good before training.
Chocolate good before training, so we can eat chocolate.
Yeah, you can take chocolate before training. Not chocolate, not the what we call milk chocolate, but the cacao, the dark chocolate.
Dark chocolate. So
yeah.
So fresh milk.
Fresh milk, yes.
So what? How about the temperature when we drink during exercise and during competition? Sometimes
cold water.
Cold water.
Cold drink.
So the degree, how many degrees?
Oh, cold drink. Anything between 5 degrees to 10 degrees is good.
5 to 10 degrees.
Yeah, cold. Yeah, cold.
So this is for exercise and game in the game.
Yes, correct. Yeah, it's good to drink cold water or cold drink.
Okay, not about the warm. It's about 20. 20.
No, cold is better because cold will bring your temperature down quickly.
I see.
Yeah.
So cold drink and milk is good.
Yes, cold milk is better.
Okay. About in the competition, so we can drink the electrolyte drink.
Yes. If you're playing football or whatever, every 15 minutes, you should drink some water or drink.
Yeah, because I ever had some competition when I was in Taiwan. So suddenly in the middle of the competition, my hand shaking directly. So I don't know what is happened. Then I feel not good, and then my friend just give me warm water, but I feel that more late, more tired. So it is not good, right?
Yeah. Cold water is better.
So cold water. How about coffee? Coffee, is it okay to improve?
Before training, yes.
Before training. So coffee before training. Cold water also.
Yeah.
Cold water.
You can have coffee. If you want to do training and you want to lose weight very fast, you can drink coffee.
Oh, so coffee can make it lose weight.
Yeah, so because coffee has caffeine.
Mm-hmm.
Caffeine can help in fat burning.
That's good. So this must be less ice with ice. I mean, the cold water or hot water.
It doesn't matter, but you can drink cold. It's fine. It's no problem.
Oh, that's good. It's very informative. Dr. Anis, want asking something? Here have a co-lecturer. Co-lecturer have a 3%, Dr. Anis Setawati, and also Koril Anam.
Oh, okay.
Yeah, and here have a Dr. Yeti. This is from other university who want to join with us and study. And so many people have Dr. Rahmat also and Dr. Jackson.
Oh, okay.
Have Dr. Kaswal Ganti Rahayu.
Yeah.
So about this one, Nordic.
Yes.
The Nordic. So what is the difference? The minute is same 20 minutes or different minutes?
Which one?
The Nordic and FIFA. In FIFA, we use 20 minutes with so many exercise. Yeah.
You can change this. You can if you think that this if you think your player can improve better with Nordic, then you change this to Nordic. You change some of these. You can change this repetition, and you can say, okay, let's do Nordic here. It's fine.
Oh, I see. That is good.
Yeah, because this FIFA is a guideline. It is not the. It's not a. it's not really fixed. You know, you can have many elements. You can change the element to something that you feel that your player can relate better. You know.
Yes, yes.
Yeah, if they have problem with hamstring, you think this exercise is not enough, then you say, okay, you do some of these, and we will do more Nordic. Then you reduce single leg stands. You say, okay, now we reduce this a little bit. You increase more of this. It's up to you, but you must have all the elements to cover this, all these things.
Oh, I see.
Yeah.
That is good thing. Okay, so any else want asking before we leave? No, doctor, Nordic. And this is can be used for the elderly, the elder.
Yes.
And I heard that yesterday, just reading some paper that high intensity interval training is good for elderly. Is it? How about that? What do you think about that?
Yeah, I think high intensity is better for anyone because high intensity training always take you to near maximum.
Oh, so to get the maximum of.
Yes, so you will do exercise at your near maximum capacity, and it is always good to work at near maximum.
Elderly also.
Yes, elderly as well.
How about the kids, the children?
Yes, children as well. Except that you must make sure in the elements that you do, they can do maximum in the intensity that you want them. I told you you can halve the intensity, but they can do near maximum of the half intensity is fine. Yeah, so all these elements can be near intensity when you do high intensity training. And I believe that high intensity training is better than the slow phase.
Intensity?
Yeah, lower intensity and longer time.
To decrease the fat. So because in here so many obesity and more lockdown, more obesity. So if we do high intensity is good for that, or
yeah, high intensity is good for them because if they do 30 minutes of high intensity, they will lose weight very fast.
Oh, that's good.
Yes. Everybody is becoming fat during COVID.
Yes, me too.
Yeah.
I increased 2 kilograms.
You increased 2 kilograms. That's terrible.
Yeah. How about
May
you?
I ask something?
Okay. Professor Ariati. Okay, you can ask.
Yeah. I know we talking about the injury on research, and how about the habit of the diet? Because I know it, Asia people really like greasy stuff, and then how like this mentally is very hard to change, but at least maybe they have to know is that impact of the injury too or no? Because a lot of food not really observing or working in the body so fast as another fat like milk, something like that. Thank you.
Yeah. I mean, if you talk about nutrition, and if you don't have enough nutrition, you can get injured. Yes, because if you don't have enough calcium in your diet, you have more of other things in your diet. For example, you don't have enough calcium, then your bone will become brittle. Then your bone can have problem in injury. And if your diet is poor in protein, for example, you are vegetarian, you poor in certain protein, then your muscle cannot recover very fast after a game or training. You need to recover, but your recovery is slow, so it causes injury. Yes, nutrition has got direct linkage with injury.
Okay, thank you.
Yeah, so it's like the people just only eat just vegetarians. So if got injury, it's more longer to.
It may take longer, but they have to eat many types of vegetables and things to have all the protein. Yeah, this is why if you are vegetarian, you are a good eater because you have to eat many things. They have to eat these different types of vegetable to get different types of proteins or nutrients or something. So they become what we call, they like to eat more than anybody else. You know, if you want to eat more, you become vegetarian, right, Titin? Because you're not vegetarian, you put 2 kilos,
Yeah.
isn't it?
Yeah, I
So
love.
you like eating, but you're not vegetarian, so you put on weight because you eat a lot of crazy things.
Yeah.
Right.
Yeah.
And even though like a sugar, you know, like the content of sugar is so much too.
Yeah, you have to reduce sugar. I
Right.
reduce
Thank
sugar in my diet. If
Right.
you reach the age of 50, you have to reduce half of your sugar intake.
Okay.
Half,
Half.
50%. Yeah.
Yeah.
So if you normally you take sugar in your coffee, you now take half sugar. And in everything, you should reduce sugar. You should reduce cakes. Everything you should reduce.
Yeah.
Yeah.
Thank you.
This is I have a question from Faisal Pakistan. You want asking something, Faisal? Faisal? Oh no. So we reduce everything. How about rice?
Yeah, reduce rice as well. I think Indonesian and Malaysia have the worst, and China, of course.
Yes.
China is #1 worst habit of cooking rice. The way we cook our rice is very bad. We use a rice cooker.
We must use panci.
Yes, you must boil the rice and then you throw the water out. Then you dry the rice again. So you don't drink, you don't eat the soluble carbohydrate.
Oh, so
You must have a big amount of boiling water. You put your rice in. Then when the rice is cooked, you throw the water out. You use what we call here strainer. A strainer. Use a strainer. Yeah.
namanya apa itu?
Tapis.
Kukus.
Kukus is good. Yes, kukus is good. One technique is kukus, and the other technique is the easier technique is boil the rice, throw the water out, and put it back in.
Okay.
That means you get rid all the boiling water. So all the soluble carbohydrate from the rice you throw them away. So this is called the boiling technique. You can Google it, how to boil rice. You know, not using a rice cooker. Rice cooker is terrible. This is all the disease happening because you eat your rice in the wrong way.
Yeah. So we must be back to ancient before.
Yes.
We now use the panci, right? Kandil, panci, everything is we have a good to cooking.
Yeah.
But now it's more.
Or you can choose a different rice. Use the brown rice.
Oh, brown rice.
Okay.
And how about if I saw last time in Taiwan, they put like olive oil when cooking the rice. Is it good? Olive oil.
Oh, the reason why they use oil is because they don't want the scum. The scum, when you boil the rice, you know, whenever you boil rice and you close the pan or the pot, you can overboil. And you get the water coming out from the pot. If you put the oil, then you reduce the scum forming on the top of the water. Then you have less spillage. This is why people use some oil, not just olive oil. Any oil can do the trick, just to reduce the what we call spillage, the scum formation from the some protein coming from the rice. So it's just a technique actually, but it's nothing special.
I see. Okay, that's very good topic and very interesting. Dr. Setia Rahayu, you want asking something? Here have our Dr. Setia Rahayu, Professor Ashril, that we are meeting in Vietnam.
Oh, okay. Nice to see you again.
Yeah. So, wait. Have a asking from where? Nali. Still Pokaris web? Faisal Fas. Okay. So anyone want asking? Maybe they have a new information about FIFA 11 plus. In Indonesia, FIFA 11 plus maybe is new, and now just we are introducing to the student.
Okay, good. You can read some papers that I have published with
With
FIFA
dancing.
11 plus. Yeah, you can give them.
I
I
want to read
published.
everything your paper.
Okay, good. I'm not sure whether I have it here. Yeah, you can go to University Malaya website. Can you see the screen, Titin? Yeah.
Yeah, I see the screen, but maybe you need to put down this first, and then you can change the screen, because this is the screen just only PPT.
Yeah. How do I do that? Now it's not working.
Just stop sharing, and then you back to share screen again.
Okay, so now maybe it's this screen, yeah? Can you see?
Okay. Yeah. I see now. Yes.
Okay, you can see now, yeah?
Yeah.
Yeah, okay, so yeah, you can see some papers that I published many years ago. They are all about FIFA 11 plus and all about injury prevention program, and they are published in all very good journals. You can have a look at how we design all the experiments, and maybe you can change something in the 11 plus and then maybe make it better, and you can invite me to collaborate with you.
Yes.
Yeah.
That's why I reading so many paper. That's why.
Yeah, you can see that 2013 and 14 we focus more on football.
Okay.
Yeah, after that we stopped working with football. We move on something else. We move on some of the injury papers as well. We move on that as well. Yeah, so you can see some of these. You can free download. All these papers are free download. So you can just click and then get the paper.
Yes.
Yeah.
Just get it in there.
Yeah, you can just click and get the paper. I think this one you can get. Some of this paper, I think. I'm not sure whether it's working.
It's working. Yesterday,
Okay.
last time just working to that.
Yeah, so okay. I think I'm also run out of time because I have another class at 2. I need to prepare for that, Titin. It has been a very nice, sharing my ideas with your student and yourself and your colleagues. I hope you have some information that you can, use in your future study or in your future research. You can do many things.
Yeah, but luckily, we're unlucky. We don't have isokinetic machine. So
it's okay. Some of the tests you can focus on skill, for example.
Yeah, we do that balance and speed, just that.
Yeah, you can focus on some other thing, but of course, isokinetic is most important.
Yes. So thank you very much for today, Professor Ashril.
Thank you very much.
Can we are doing take picture together before?
How do we do that?
You can turn off the share screen, and then we'll have so many people in there.
Okay, so now I need to stop share, right?
Yes.
Okay, now I do stop share.
Okay.
Okay.
Before we have 175, and now just 91. Please open your camera, and we can take picture together.
My camera is not so good, but yeah.
Okay, it's good. No problem. Miss Kaswarganti, Dr. Yati. Okay, please open all the camera. So we just do selfie. Pak Mustafa masih di sini? Hello? Okay, so I will help you to take it. Wow. Okay. Wait a minute. 1, 2, wait, there is a 1, 2, 3, slide 1. Slide 1. I must copy first. Okay, I will copy in here. Okay, then slide 2. I'm sorry, Dr. Ashril. Just for report.
Okay, no problem.
Okay. Oh, slide 2. Why no people open the camera? Slide 2. Hey, just only slide 1. Open the camera. What happened? Don't be shy. Okay. 1, 2, 3. Bu Ayu. Bu Ayu terlihat. Wait a minute. Slide 2. And then slide 3. Hey, what happened? Okay, sorry. My 1, 2, 3. Press screen. Slide 4. I'm sorry, I'm so old, so not good enough to do like this one. Okay, good. Wait a minute. Okay, raise your hand. Say hi to Professor Ashril.
Hi.
Okay, thank you very much for today. Professor Dr. Ashril Yusof is very interesting topic and helpful for us to conduct some research, and especially for students in sports science. And this is new method maybe for study about harmony in FIFA 11 plus to prevent injury program.
Yes, sure. You can have a look. You can download the papers. It's free of charge.
Yes, and I already asked to my student who study about that to download from you.
Oh, okay, good.
Use your paper to do that. And before that, maybe any something that you want to say to us?
Yeah, I wish you all the best for your semester, and of course, stay safe at this time. And then, you can do many interesting exercises at home to keep fit. Because keeping fit is the key to reduce incidence of injury. So stay safe, stay fit. Okay, thank you very much.
Thank you, Professor Ashril.
Thank you very much.
Thank
See you
you.
well.
Assalamualaikum warahmatullahi taala
Waalaikumsalam.
wabarakatuh.
Thank you very
Waalaikumsalam
much,
warahmatullahi
Mr. Asriel.
wabarakatuh. Stay safe.
Waalaikumsalam
Warahmatullahi wabarakatuh.
Thank you.
Thank you.
Wait, I must give some certificate, but I forget. I have certificate for you.
Okay.
Okay, the certificate is from the dean.
Oh, okay.
The photos. Where is the photos? Wait a minute. The photos, not this one. Okay. Oh, sorry. Hey, wait. Where is the photo? So I must give you this one.
You will send it to the email, is it?
Okay, so I send to email.
Okay, that's better.
Okay. So
Okay, take care. Take care, everyone.
Dr. Ashril Yusof, I'm sorry to take your time.
Don't worry.
So
Bye-bye.
we need still your cooperation. Bye-bye. See you.
Bye, see you.
Silahkan untuk bisa diisi apa namanya sertifikatnya, kehadirannya, monggo bisa diisi semuanya. Jangan sampai nanti lupa mengisi dan tidak mendapatkan sertifikat untuk hari ini. Halo, sudah diisi semuanya? Ada yang
Sudah, Bu.
Udah, Bu.
Udah. Belum, Bu, belum.
belum? Masih ada yang belum? Saya
belum. Masih di jalan.
Silahkan diisi. Nanti waktunya akan habis setelah 1 jam, nggak bisa ngisi lagi. Oke. Ganesh ya? Oke, Mbak Meta. Makasih Mbak Meta masih di sini. Bu Setia terima kasih. Faisal, Faz, thank you.
Thank you very much, ma'am. I'm very happy to attend this webinar, and I'm really grateful to you that you people allow me to join this session. And overall, the presenter, the researcher performed very well and very precise in the basically precise way provided and delivered the whole information. It's very good. I'm very happy, and thank you very much. And kindly keep remember me in all your next webinars. I have mentioned my email ID, my WhatsApp number as well. So I'm really grateful to meet you to join this session as well. Thank you all.
Thank you.
Okay, thank you.
Ada yang mengisi? Masih ada yang belum mengisi? Semuanya. Pak Suyatno. Okay. Thank you, Lisa. Thank you everyone who's joined this class, and see you next time. We will have
See you, ma'am.
other topic. Oke, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Hafiz.
Ya, apa?
Waalaikumsalam.
Mustafa, mungkin bisa ditutup Pak Mustafa. Halo, Pak Mustafa. Pak Mustafa, where are you? Okay, so okay. Mana Pak Mustafa ya? Oke, bisa dimatikan Pak Mustafa. Untuk YouTube-nya udah selesai, recording-nya udah selesai. Stop recording. YouTube-nya juga sudah selesai, bisa? Halo? Nanti yang terlambat bisa ngikut melihat di YouTube. Silakan, di YouTube-nya ada. Halo? Silakan. Mom, I get. Okay. Oke. Bisa live ya?
Okay, thank you very much. Take care. Allah Hafiz. I'm going to leave. Allah Hafiz.